Well, good morning, everyone. This is Karen Bloomer with the consulting team. Welcome to this virtual commission meeting of the Healthy California for All Commission. I'm just going to spend a moment talking about our virtual protocols for the meeting and then hand it over to Dr. Chen. So first, just as a reminder, this meeting is being recorded and the video recording will be posted on the Commission's webpage just a few days after today's meeting so that all can view it. Commissioners, during this meeting, you'll have the ability to mute and unmute yourselves and the option to be on video. And it looks like so far you all have opted for that, and we appreciate that. Please do mute yourselves when you're not speaking so that we can reduce background noise. When you would like to speak, we'd ask that you use this yes green check mark feature, and you can find it by, and feel free to practice this now. If you click on the participants icon at the bottom of your Zoom screen, so click on that now, you'll see the participant panel pop up to your right. And at the bottom of that panel are a few different icons to choose from, including that green yes check mark. So we, the consulting team, will keep that panel open during the meeting. And when we invite input from commissioners, we'll be looking to that screen to see who would like to speak. For members of the public, we are trying to continually evolve our meeting design to simulate in-person meetings. And so in today's meeting, we are going to offer public comment during the public comment periods today. So during the meeting, you'll be able to listen and view what is going on. And then when we ask for public comment, that is when we will enable the chat feature, at which time you can provide written comment. We will also invite members of the public to indicate a desire to speak verbally, and we will start a queue to invite public speakers at that time. We will go through those steps with you when we reach the first public comment period. You're also welcome always to email us at healthycaforall@chhs.ca.gov. And of course, all of public comments that are received during this meeting will be considered part of public record.
Karen, this is Sandra Hernandez. I can't find the green check mark that you referenced.
Okay, Sandra, thank you for letting me know. And there may be others of you who are struggling to see it. If you don't see it at the bottom of your participant panel after clicking on participants, do feel free to use the chat feature. So commissioners will have the chat feature available throughout the meeting, and everyone viewing can view the chat feature. So Sandra and others, if you're struggling to find that check mark, please feel free just to indicate in chat that you'd like to speak. And of course, you can unmute yourself as well if you feel that we've overlooked your request to speak.
Got it, thank you.
Thank you. And with that, I'll turn it over to Dr. Chen.
Thank you so much, Karen. I believe Eric's going to do a roll call first, and then I'll do some welcoming comments.
Wonderful.
Good morning, commissioners. Yes, good morning. It's Eric Douglas, and I would like to just do a quick roll call to make sure who is here. So Commissioner Comsty.
Here.
Commissioner Chin Hansen.
Here.
Commissioner Sandra Hernandez.
Here.
Commissioner Shao.
Here.
Commissioner Maria.
Here.
Commissioner Ross. Was that a here? Was that a yes?
Yes, here.
Okay, thank you. Commissioner Schneider. Here. Commissioner Phlox.
Here.
Commissioner Rocco.
Here.
Commissioner Hernandez, Antonio Hernandez.
Here.
Commissioner Wright.
Here.
And then of our ex officio members, Peter Lee.
Here.
Don Molds.
Here.
Richard Pan. Jim Wood. And Will Lightbourne.
Here.
Here, sorry, I was muted.
Thank you, Jim. Appreciate that. So I note that the only member of the commission who is absent is Richard Pan. I'll turn it back to you, Dr. Chen.
Great, thank you. So good morning. It's so wonderful to see all of you and that more than 200 members of the public have joined us. Secretary Galley isn't able to join us this morning, so I'll be chairing the meeting. I'll just make some brief welcoming remarks. As you know, the administration has been very focused on addressing the pandemic, ensuring that both public health practices and public health capacity are there to ensure responsible opening of our schools and of our economy. You know, lots of activity around testing, contact tracing, data, supporting our essential workers, supporting businesses, hospitals, with a real focus on the most vulnerable, our residents in our skilled nursing facilities, incarcerated individuals, as well as our communities of color, with a real focus on the Central Valley right now. I hope you've been focusing, following some of that work. We're also committed to the investments and structural changes that are needed to make California a more equitable society and ensuring a stronger safety net going forward. And certainly the work of the commission is part of that effort. So since the last meeting, a lot has been done, a lot of work has been put in on this front. We'll be talking today about the environmental analysis report, which has been completed. There's been revision of the community engagement plan with a lot of input from many of you, which is very much appreciated. And preparing for today's meeting, hope that all of you had a chance to review the video and materials that were sent out. And I think we're moving on to the next slide. I do want to do a quick overview of our sequencing. As you remember, last month we focused on equity and improving quality. Today we're hoping for a rich discussion on financing, no pun intended. Provider payment is coming up next month, and then in the ensuing months, really digging into how we might administer whatever program is developed that for unified financing or single payer in terms of intermediary organization roles, some of the specifics around eligibility, covered benefits, and patient cost sharing, and importantly, governance and cost containment. So with that, let's go to the next slide. In terms of the environmental analysis report, really want to thank our consulting team. They've spent many, many hours, both on the initial report and then incorporating both public comment and your comments in an iterative fashion. We are going to be holding an advisory vote on the report, but before that, we're going to have Marian Mulkey just do an overview of the process that's been that has taken place over the last several months. I do just want to say at the outset that both Secretary Galley and I have reviewed this and are really in support of both the content and moving it forward to the governor's office. So with that, I'll send it over to Marian. Thank you.
Good morning, and thank you so much, Dr. Chin, and wonderful to be with you, members of the commission and members of the public. I'm Marian Mulkey, a member of the consulting team that is supporting the Healthy California for All Commission with Dr. Andrew Beinman and several terrific colleagues who are named in the report. I helped draft and revise the environmental report that we are here to discuss today. Next slide, please. By way of context, as I'm sure you're all aware, the enabling legislation for the commission charges the commission with delivering 2 reports. This first one is described in 3 parts and is assembled in 3 parts. The first and longest segment analyzes California's existing healthcare delivery system with issues related to equity, coverage, care delivery, quality, payment, access in California now. The second section describes options for additional steps California can take to prepare for transition to a unified financing system. And the last, most brief section offers options for coverage expansion. Next slide, please. Our process to date is, as we've indicated, that the drafts have been authored and revised by our consulting team. 2 prior versions were made available for commissioner review and comments. In June, we shared an initial draft, which was also shared with the public and was discussed during the June commission meeting. In July, we shared with members of the commission a substantially revised version that really benefited greatly from input from many members of the public, from many members of the commission, and was improved in both, I think, substance and content. And we, again, very much appreciate the input we received. Today's version is yet a 3rd revision, and it reflects a number of additional changes based on comments that we received from members of the commission through August 3rd. Next slide, please. So in that last set of commissioner comments, again, which were rich and nuanced and informative, we handled them in the following ways. When there were specific line edits or requests for additional context that could be made within the structure that we had presented to you in that second draft, we did our very best to make those changes in accordance with the input that we received. However, there were a few requests for elaboration of a pretty extensive sort, or identification and incorporation of new data, where within the time frame that we were operating under, we were not able to make changes. In that case, though, those suggestions will certainly inform the content of future meetings and the second final report, which is envisioned for early 2021. In addition, when members of the commission were offered the opportunity to provide formal comments in the form of a 1-page letter, 4 members did so, and those are included as an appendix to this version of the report. And a last note is that following today's deliberations, formal public comments will be invited, and if members of the public or stakeholders wish to deliver through email comments that they want to have posted in connection with the environmental report, there'll be guidance distributed by email and a process for doing that that we hope will be straightforward and allow further comment. So with that, that's my summary of the process through which we've arrived at this point. And Dr. Chen, I believe you'll speak to next steps for the meeting.
Thank you, Marion. So there's never enough time. We felt it was important to build in time for both public comment and an opportunity for commissioners to make any statements they wanted in terms of how they've received and are planning to vote on the report. But I do want to preview the advisory vote. So the vote is on whether the Healthy California for All Commission should accept the final environmental analysis report and whether it should be therefore transmitted to the governor and the legislature. And when you are asked to vote, yes signifies that you believe it should. So just to put that in your on your radar as we move forward to public comment and commissioner discussion. I'll turn it over to Karen.
Thank you, Dr. Chen. So now we're going to invite public comment today during the meeting. To do so, we will be now opening up the chat feature to members of the public if you'd like to provide written comment during this period. And we're also going to invite members of the public to speak if they would like. And so you'll see members of the public that you'll have the opportunity to use the raise hand feature in the participant panel to request to speak. And when we see those raised hands, we will invite you one at a time. When you do that, please state your name and any affiliation you have with an organization. So we'll start with Craig Simmons. We invite Craig Simmons to unmute himself and introduce himself. And you'll have, you'll have 60 seconds and I'll let you know when you're down to the wire. Thank you. Go ahead, Mr. Simmons. Mr. Simmons, you were unmuted there for a moment. Do you want to try again to unmute yourself? Go ahead.
Can you hear me now?
Yes, sir.
Okay. I'd like to speak for a minute, if I could, on SB 562. Now, that was the Senate bill sponsored by Tony Atkins that has been kind of through in the legislature for a while. The problem with SB 562 has been essentially we haven't been able to figure out a way to pay for a single payer authority. So I'm a single payer healthcare plan. So I'm proposing a ballot measure for a payroll healthcare tax, which would generate enough revenue to create a surplus, actually, to cover all healthcare costs, surgeries, outpatient services, preventive care, for about $40 a month, payroll deduction, based on a 25-cent per hour payroll tax deduction.
5 seconds, Mr. Simmons.
There's precedent for it. Teamsters Union and Kaiser Family Foundation program, and I'd be happy to discuss it more if you can give me more than 60 seconds.
Thank you, sir. I appreciate it. I do want to turn to others who would like to speak. So next is Jeff Tartagia. If you'd like to unmute yourself, sir.
Can you hear me now?
Yes, sir. Please go ahead.
All right. So 1 minute to say that I thought the Healthy California Commission was examining how in the world you finance single payer. It's clear that our public health system cannot deal with this pandemic. It is clear that California desperately needs, with all the unemployment and everything else, some health system that provides the means to, should we say, go to medical doctors. You're not doing that. So I'm sitting here looking at an environmental report. Gee, like if you were guys to be into climate control, they are impacting factors, but I thought Healthy California Commission was supposed to examine, and you only looked at 562, not the previous single payer measures that have been for 20 years put out there. I think my time is up.
Yes, thank you, sir. Thank you very much. Benjamin Tran, we invite you to unmute yourself, sir. Please go ahead.
Hello, Benjamin Tran with the California Pan-Ethnic Health Network, or CPAN for short. CPAN would like to express appreciation for the added section on equity and community health and their elaboration throughout the report on racial and ethnic disparities and issues affecting other marginalized communities. We also appreciate their updated references to COVID-19 and the disproportionate disparities and the effects of the pandemic. Appreciate these added sections and hoping to continue to work and provide more support to the Commission in terms of highlighting these different disparities and the impacts on marginalized communities. Thank you so much.
Thank you, Mr. Tran. I do appreciate you responding to the agenda item at hand, which is the environmental analysis report. Appreciate if members of the public could reserve their comments for this agenda item. Thank you. Peter Shapiro, we welcome you to unmute yourself.
Thank you. I'm the Alameda Labor Council delegate for the California Alliance of Retired Americans. And I actually appreciated the added language in the latest version of the report, which points out some of the dangers of capitation payment schemes, and I trust we'll come back to that. I continue to be puzzled by the report's emphasis on fee-for-service as a major driver of healthcare costs. It's something that's never really been documented. Overutilization is clearly not the problem. It's that whole emphasis seems especially inappropriate during the worst public healthcare crisis in the century, when tens of millions have been left with no way to pay for treatment, and Black, brown, and underserved communities are being infected and dying from COVID-19 far out of proportion to their numbers. The real problem with our system is that not that too many people are getting unneeded care, it's that far too many people who need care are not getting it. And the problem, I think, with some of the
5 seconds.
alternatives that have been proposed to fee-for-service is that they actually greatly add to the administrative burden, which is driving primary care physicians out of the field. They lack because they lack the resources and the time to provide the kind of documentation that's required to justify the costs incurred in treating their patients.
Thank you, Mr. Shapiro.
Providers. Okay, I'll leave it at that. Thank you.
Thank you so much. Appreciate it. Next, Lynn Silver, we invite you to unmute.
Thank you. Lynn Silver, co-chair of the California Alliance for Prevention Funding. Thank you for the opportunity to speak. Very briefly, in addition to finding a profound and transformative way to achieve unified financing and coverage for all people living in California, I would note on page 46 of the environmental analysis, there is a graph displaying the burden of preventable chronic conditions that cannot be cured by healthcare alone. So again, we reiterate our request that as you plan an integrated, unified financing and design scheme for our healthcare system and for addressing health equity, it is essential that some level of increased investment in community-based prevention and building community, healthier communities, capacity of local health departments and community-based organizations to prevent that preventable burden of chronic disease, injury, and premature death that we're
5 seconds.
with COVID is an essential component. Please do not leave that out once again, as has occurred every year in the past.
Thank you very much. Yusra Hussain, we invite you to unmute. Please go ahead. Yusra, it looks like we've lost your audio. Can you try to unmute one more time? There we go. Please go ahead. Ms. Hussain, go ahead. Shoot, I'm sorry. I can see that you're unmuted, but we can't hear you. I'm sorry, I'll look for your name again later, but we should probably move on to F. Thompson. We invite you to unmute.
Hi there, my name is Felix. I'm a nurse. I work in our one of our public county hospitals in UR and discharge planning. And I can attest to the cost of having a two-tiered healthcare system, one for the poor and one for the rich, that would continue under any kind of public option system rather than a single payer system. Right now, we have patients who sit in our public hospital for weeks or months awaiting a follow-up with home health or with a SNF that cannot be covered because of our two-tiered system. And I think it just points to the cost that's ultimately on the public due to our failure to have like a unified single payer system for all. So I hope that that will be the priority of this commission.
Thank you very much. Linda Bassett, we invite you to unmute.
Hi, yes, thank you very much. My name is Linda Bassett. I'm an elected Los Angeles Central County Committee member. I'm retired LAUSD, where as House of Rep representative, all of LAUSD, or the teachers, are in favor of a single payer healthcare system. They understand the value of it because they're being gouged. They can't get a raise at all because our healthcare system is gouging them. That I grew up in Canada. I've experienced healthcare for all. The people love it. I don't understand what the issue is. I've lived in Italy, Spain, Germany, and Britain as a military spouse. They all have healthcare for all. There's no complaining there about their healthcare system. Even the military, you have a healthcare system already that exemplifies what we're talking about. I don't understand what your environmental study is all about, because if you want people to live healthy lives and live in a great democracy,
5 seconds.
You will say yes, that we need single payer healthcare. Thank you.
Thank you. Tracy Rattray, we invite you to speak next. Tracy, can you unmute yourself? Go ahead, Tracy.
Hi, good morning. Can you hear me?
Yes, we can.
Oh, okay. Thank you. Good morning. This is Tracy Rattray, Executive Director of the California Alliance for Prevention Funding. Partners across the state are advocating to promote health equity by investing in prevention in any plan to reform healthcare in California. I urge the Commission to include funding for community-based prevention and health equity in any plan to reform healthcare in California. Investing just $10 per person per year in a California wellness fund to prevent the leading causes of illness, injury, and premature death would represent a mere 1/1000th of what California spent on healthcare delivery in 2018. Wellness funds in other states have shown remarkable success in reducing risks for chronic disease. Just a few examples: a reduction in soda consumption among Oklahoma families, increased access to healthy food and physical activities at schools in Minnesota, and a decrease in pediatric asthma in Massachusetts. Thank you for your time.
Thank you so much. And that completes our 10-minute segment for public comment, but we will be opening up public comment opportunities again after the next agenda item. So we thank you all. All right, I'm going to move things back to the Eric Douglas and commission discussion. Thank you.
Thank you, Karen, and thank you for that public comment. We now have about 14 minutes in our agenda for commissioners to say a few words about, if you wish to preview how you plan to vote and why. This is your opportunity to do that. Please, again, use the yes check mark to indicate if you wish to speak. I apologize if I take people out of order. I can only see the list of participants on one screen over here, and I'm facilitating over here, so please bear with me. So if I could, I'd like to first call on a commissioner to speak, and perhaps I could ask Commissioner Sandra Hernandez to start. Sandra, can you unmute yourself, please? There we go.
Thank you, Eric. Good morning, everybody.
Good morning, Sandra. Your audio is flanging, so we're
I'll
not
be
hearing you
brief.
clearly.
Let me first, Eric, can you hear me?
We can, but if it's flanging a bit, so if you could speak a little bit more close to your microphone, that would be good.
How about now?
That's a little better, thank you. Yeah.
Eric, can you hear me?
I'm sorry, Sandra. It's the audio quality is not very good, and so
Eric, can you hear me?
It's coming in and out.
Well, let me just be very brief in this report.
I'm sorry, we are not hearing you, and so if I can, let me turn to other commissioners who have their hands up, and maybe we can come back to you, Sandra. So let me go to Commissioner Bill Shao. Bill, would you like to comment on the report and how you're planning to vote?
I found the report is very comprehensive. Give us a snapshot of the situation in California so we can actually know how to move. And I intend to vote for the report. However, I find there's a shortcoming in the transition section. It really is not that comprehensive about what transition measures the consultants and the commissioners should consider. And then later on, I will speak on that.
Thank you, Commissioner. Let me turn next to Commissioner Bob Ross. Bob?
Yeah, good morning, everybody. Can you hear me okay, Eric?
Mm-hmm. Thank you.
Yeah, thank you, Bill. I'm pretty much where Bill is. Pleased with the report. Tough audience, tough crowd, but I appreciate the the constructive feedback about the report. And I appreciate staff getting those, attending to those issues and areas. Both as an individual commissioner and our foundation, California Endowment, we're in line with at least 2 or 3 of the speakers, of public speakers, around emphasizing, yes, the critical importance of getting to a unified financing mechanism, but also matters of the social determinants of health, health equity, prevention, community-based prevention. We just don't want to leave those issues behind. And so I intend to support the report, but agree that the transition roadmap part of it, I assume that will be coming along further, but that's going to need more work and attention from us. And I'll put in a plug. I've got a piece that just is running today in Cal Matters as an op-ed about our foundation's support for the Health for All Commission and what we're all trying to collectively get done. So thank you.
Great. Thank you for that, Commissioner Ross. Commissioner Comsty, you're next.
I want to express my appreciation for the consulting team's consideration of my extensive feedback. For those watching, I've linked my lengthier comments in my one-page attachment, but I have fundamental disagreements with some of the analysis and recommendations in the report, and I want to mention them here. First, the report to a certain extent misses our legislative charge. Many of the recommended actions in the report would not prepare California to transition to a unified financing or single payer system. And some of the recommendations would even further our fragmented system. This includes the recommendations for further reform of commercial plans or for further regulation of fragmented plans within public programs. Second, although this is mentioned briefly in the report, the Commission should clearly and unequivocally recommend and prioritize the recommendation that the legislature and the governor not only draft, but pass legislation implementing a single payer program, and that the legislature and governor draft waiver applications and enter into negotiations with the federal government. We simply should just be clear that the legislature and the governor, not Congress, nor the federal government, is responsible for initiating the action that would begin the state's transition to a single payer. And lastly, I just want to raise the issue of transparency and the lack of transparency in the drafting process. As far as I can tell, the report is a reflection of the consulting team's analysis and opinions and not the Commission's. I wrote over 30 pages of comments, and again, I appreciate the consulting team's incorporation of some of my feedback, but they didn't address all of it. And I certainly didn't expect consensus, but the report doesn't recognize where there was disagreement among commissioners. And other than the one-page comments, I don't have an understanding where the other commissioners stand. So with this, and without the detailed conversations with commissioners, and without the written comments of commissioners being public, and without the time to set aside for the Commission as a whole to discuss these issues, which I believe, I had hoped, and I believe other commissioners had hoped would have happened through the creation of public advisory committees, but that didn't happen. And for all those reasons, and for all the reasons I've stated in my longer written comments, I will not be recommending transmission of this report to the legislature or governor.
Thank you, Commissioner. Appreciate your remarks. Commissioner Phlox.
Thank you very much. I think as an environmental scan, which is part of the charge of this report, it is much improved from the previous versions. I appreciated the section on consolidation in the healthcare industry, the role of price, many of those additions to the report. I will echo the other commissioners and Commissioner Costi on section 2, I think is weak in the recommendations, not very clear, and does stray from the charge of steps to a unified financing system. I think it could be a lot clearer of what exactly could be done in terms of legal considerations and waivers and financing and all of that. But I do hope that for the next report and for the future meetings of the commission, that is exactly what we will tackle in how do we get to a unified financing single payer system, the nitty-gritty details. So on the strength of the environmental report, I will be voting to recommend moving it forward.
Thank you. Thank you, Commissioner. Commissioner Sandra Hernandez, I'm going to go back to you and just see if your audio is working better now.
Try now. How about now? Can you hear me?
That's really good. Thank you.
Great. Thank you, Eric. Well, look, let me be brief. First, let me say that I think the report very well covers many of the extraordinary challenges we have with our current delivery system. I think it's really important to focus on the delivery system. In any changes that we have the opportunity to make, and by the way, I think there are many notations of data in the report that reference policy matters that are before the legislature now, and that could well be acted upon now to address many of the issues that were described in the report. I especially want to appreciate the notion that the system that we have now is a system that has systemic racism embedded in it. And as we think about any future changes, we should be very mindful that we don't recreate that. In that regard, the reference in the report to the phenomenal challenges we have in the workforce that are gaps and that contribute significantly to the racial disparities we see is another opportunity to significantly improve upon our delivery system. I want to acknowledge as a process matter that the staff did take into account most of my comments, and I appreciate that. And consistent with other commissioners who have spoken here, I too will give my vote of support to send the report on to the governor and the legislature. Thanks, Eric.
Thank you very much. So we have a couple of more minutes for commissioner comment before we need to move to the vote itself. And I have two more people on my list who need to speak or want to speak, Commissioner Wright and Commissioner Rocco. So let me start with you, Commissioner Wright.
Yes. I thank you for all the good work of the consultants. The environmental scan is impressive in terms of getting all the to do an overview of a lot of the complexity of our healthcare system and to just try to detail it and catalog it. I do, but in any review, it's going to be missing some things. But I do want to highlight both Dr. Ross's comments about the interactions with the public health system and how this can, our health system can interact with the broader levers we have to actually improve people's health. But also particularly, I think, because it's central to the issue of, I think what we're doing here, the issue of the consumer experience. It's implicit that the report does detail sort of a very fragmented, complex, confusing healthcare system, but I think that, it leaves it implicit and not explicit what that means for the consumer experience. One that is of disempowerment, one that is of not just gaps in coverage, but people making life choices, career choices based on the ability to have access to affordable healthcare. And so I think that it's important to center the consumer experience. For example, this fundamental question of, if you do have a problem in the healthcare system, where do you call? And right now, you know, my organization has been very proud to advocate for many of the consumer protections that exist, but because of our fragmented system, it's not entirely clear, you know, where the accountability is, where you get justice. And so, you know, those are things I had hoped would be in there. So a lot of my comments were taken, but those are things I would want to highlight because I think that's important for the next step. I see this as the problem statement because it is because of the issues detailed in this report and this consumer experience of disempowerment and insecurity that I support a single payer system, that my organization supports one. And I think that that needs to be central in the solutions that we come up with. My final comment is that I will be voting for this on the strength of this very good environmental scan, but I do think that the second two sections about dealing with the obstacles of single payer and how we get around them, whether it's the legal issues, whether it's the procedural or constitutional issues, we can that needs to be more detailed. And then the question of preparatory steps. I feel the urgency of this moment, and I feel like there are that even while we're waiting, not just developing this plan, but even if this plan is passed, even if we submit a waiver, there will be a time where California should not be waiting, but should be acting as soon as possible. And maybe that's better done once we have the plan written out in February, and then we work backwards from that. I do think that there might be a debate between commissioners about what is a preparatory or transitional step and what is not. But I do think we want to explore that. So with that, we would support the report, but hope that we would visit those second two sections in the final report.
Great, thank you so
I'm
much.
having a little trouble dialing in. I'd like to speak after everybody's done, okay?
All right, Commissioner Scheffler. So we have just minutes in our agenda remaining for commissioner comments. So if we could keep the remaining two commissioners' comments relatively brief, I would appreciate that. Commissioner Rocco.
Thank you. I think in terms of the environmental scan, there's a lot of information in here. I do think it is helpful to pass it on to the governor and the legislature to have them begin contemplating these issues again in a way that has not been the focus this past year and a half. I also think that I'm mindful that we are ultimately submitting two reports to the legislature and the governor, the first of them being this one. And, you know, I think that some of the shortcomings that folks are discussing in terms of not digging in deeply and as broadly to certain issues in the second section in particular are things that can be improved by process going forward. I think that when we started this process, we had a lot less time to draft this report than was envisioned under the statute because the commission got started more than 6 months late. And, you know, now then we were going to only meet quarterly, and now we're in the middle of a pandemic. So I think we've done a reasonable job given the constraints, but I think that the second report will be very important, and it's good that we've made process improvements of how the commission is operating. I do think that more ability to have discussions about the actual report and the content will be important for the second report because we can't collaborate with each other or spark ideas and come up with the best possible solution unless we're able to engage with each other in this public format more thoroughly for the next report. So I would just encourage that. Thank you.
Thank you, Commissioner. All right, Commissioner Scheffler, again, we have just a minute or two for your remarks, if you could. Thank you.
Sure, I'll be very brief. Can you guys hear me?
We can, thank you.
Okay, so first let me say that I'm an enthusiastic supporter of this report. I think it is very well documented and very well put together for what it does. As I indicated in my one-page letter, I think there should have been more, and maybe there still can be some discussion of the waste in the healthcare system. We don't want to finance waste, and it's pretty clear that about a third or 30% of the healthcare system is wasteful and even harmful. Second comment that I've made repeatedly is I think the health workforce section needs to be broadened beyond physicians and have some discussion of other health workers, nurses, frontline workers, et cetera. They just don't get the attention that in the section that physicians do. And then thirdly, I think it would be incredibly interesting and important to note some of the amazing innovations in the healthcare system, both on the medical level and the new discoveries and the things that are going on in California, and also highlight some of the more important innovations in the delivery of healthcare throughout the state.
Great. Thank you, Commissioner. All right, next slide, please. I'm going to once again preview the advisory vote itself, and then we'll go through a roll call vote. It says here that we're going to use the chat, but in fact, I'm going to do a roll call just to make sure that we have a good accounting of each person's vote. So again, the question is on whether the Healthy California for All Commission should accept the final environmental analysis report and that it should be transmitted to the governor and the legislature, and a yes vote signifies that you believe it does and should. So I am going to just go through the same roll call that we did before in alphabetical order. Commissioner Comsty, how do you vote?
No.
Thank you. Commissioner Chin Hansen.
Yes.
Thank you. Commissioner Sandra Hernandez.
Yes.
Commissioner Antonia Hernandez.
Yes.
Thank you. Commissioner Bill Shao.
Yes.
Commissioner Rupa Maria.
Sorry, I was hoping to speak earlier, and I feel it's unfortunate that there's not enough time to give all the commissioners who want to speak a chance to speak. I'll be voting no.
All right, thank you, Commissioner. Commissioner Bob Ross.
Yes.
Commissioner Richard Scheffler. Commissioner Scheffler, how do you vote? Can you unmute yourself, please, Commissioner? Commissioner Scheffler, could you unmute yourself?
Yes.
Yes, thank you. Commissioner Schneider.
Yes.
Thank you. Commissioner Phlox.
Yes.
Commissioner Rocco.
Yes.
And Commissioner Wright.
Yes.
So by my tally, we have 10 yes votes and we have 2 no votes. And so the advisory vote carries with regard to forwarding this on. Thank you very much for your contributions to this discussion. And we are going to move on next to the update on community engagement. Dr. Chen, would you like to do a quick word of introduction for this segment of our agenda?
Thank you, Eric. And just a big thank you to the commissioners. The point that Commissioners Comsty and Rocco made are well taken about that this entire process and the content, the reports would benefit from more robust discussion. We're again iterating on our new context and technologies, and we'll definitely be taking that into account. Just wanted to though appreciate everyone's time and expertise, because that really did enhance and strengthen the report. Which is a good segue into our update on community engagement. In a similar way, really appreciate the input and guidance of many of the commissioners, which I think strengthened our community engagement plan. We're really looking forward to an inclusive process that can inform our discussions going forward. And with that, I will ask Bobby Wunsch of the consulting team who's been leading this effort to do an overview of the revised proposal. Thank you, Bobby.
Great. Thanks, Dr. Chen. And again, thank you to all the commissioners for your feedback at the last meeting in July about community engagement, and also to the commissioners who provided some very helpful and detailed feedback in between the July meeting and now.
Bobby, can you turn up your volume just a little bit? You're a little quiet, and it would be great to hear you a little louder.
Okay. How's this, Eric? Is this better?
That's much better, Bobby.
Great.
Thank you so much.
If we could go on to the next slide. We've revised the community engagement process, and I'd like to just highlight a few of the revised pieces that we're going to talk about today. The timeline has been revised based on feedback. We have moved from a geographic focused set of community engagement meetings to a population focused group of community engagement sessions. We've developed a set of criteria in which to choose the co-hosting community organizations. We've developed some guidelines for participation of community residents and community organizations in the listening sessions. And we've revised the questions based on your feedback for the listening sessions. So as we go through the presentation, I will specifically highlight those issues for you. Next slide, please. So again, just to remind everyone, the purpose of these community engagement listening sessions really is to hear directly the voices of those Californians, particularly low-income community residents and the community organizations that work with those individuals, to hear the voices of people who are not always heard in these types of policy discussions, and to test the ideas and the concepts with them that the Commission is thinking about and working on. Next slide, please. We're hoping to learn from excuse me, these community residents and community-based organizations in these listening sessions, what their perspectives and preferences are for the key design features that you'll be discussing. Next slide, please. So just a reminder, we're looking at having 2 series of input sessions with 8 to 10 high priority population-based groups in Zoom meetings because of the pandemic. The first series of meetings will happen in late September, early October, so that we can present the findings from that series at the October Commission meeting. The second series will happen in mid to late November, early December, so that before the December meeting, we can present another round of findings from the community engagement listening sessions. All of the sessions will be open to the public, and we will reserve 30 minutes at the end of each meeting for public comment. And we would be pleased to have members of the Commission join any of these listening sessions. Next slide, please. As we discussed at the last meeting, we would like to invite a community-based co-host to help us organize and to sponsor each listening session for each population group. We expect that each co-hosting organization will receive a grant from the California Endowment to help us recruit, facilitate, and provide support to the participants in each population group. The co-hosting organizations, as well as the participants, will receive orientation about the Commission's purpose prior to the sessions. And it's our intention that each population-based group will have a balance of community residents as well as community-based organizations serving that population group. And our preference will be to have as many community residents as possible. The population groups, and again, this is a change from the original proposal based on your feedback. We've moved away from the geographic groupings to population groups, and some examples, not inclusive of all the groups, but some examples would be groups with African Americans, groups with Latinos, both immigrants as well as farm workers and other Spanish-speaking community residents and organizations serving them. Native Americans and representatives of tribal entities, the Asian American Pacific Islander, ethnic groups all across the state, seniors and retirees, people with disabilities and chronic conditions, as well as we will probably have a group representing rural community residents. Next slide, please. As I mentioned earlier, we've developed a set of selection criteria so that as we work with the California Endowment to identify community organizations who could co-host, we will look for those who are well recognized and have an effective history working with the population group, that they've had experience recruiting and orienting members of the population group that will be part of their listening session, and that they have the ability to support particularly the community residents who will participate with interpretation and translation services and technical support so that they can participate effectively in the Zoom platform. We will also require that each of the community organization hosts be willing to have their organization listed on the website of the Commission, and if requested, to present findings from their listening sessions to all of you at one of the upcoming meetings. Next slide, please. As I mentioned, we've also developed guidelines for the selection of participants. You can see those here. We're really looking for individuals who can articulate the views and concerns of the population group from which they come, and be willing to talk in a public setting about health-related issues. We would like to assure to the participants confidentiality in terms of their names will not be published as part of the summary of these meetings, but we will definitely ask and report on the demographics of the individuals in each of the listening sessions, what population group they self-identify with, their county of residence, and their insurance status, age, and gender. Next slide, please. Based on lots of feedback from commissioners, we have revised the major topics for both Series 1 and Series 2 of the listening sessions. This is not the script for the listening session. That will be developed subsequently. These are the major questions that we would like to focus on, and as you can imagine, there'll be a number of probing questions to have a robust discussion. These are the questions for Series 1 of the listening sessions. And then if you go to the next slide, you'll see the topics that we'd like to focus on in Series 2. So this is the late fall, early winter series, and we will develop questions to solicit feedback from all of the listening sessions on a number of these topics. Next slide, please. So in addition to the community-based listening sessions with the population groups, we will also have a series of multiple sessions with groups of key stakeholders and their organizational representatives. These sessions will be held in late September through January, and the participants in these key stakeholder groups will include statewide health advocacy organizations, labor groups, single payer advocates, employers, and providers. Next slide, please. And as we discussed at the July meeting, we will report back to the Commission regularly, both in written summaries from the listening sessions and the stakeholder meetings, sent in advance to the commissioners and posted for the public to review. And then as appropriate, we will invite 2 to 3 of the co-host community leaders to join us at a commission meetings to reflect and let you hear directly what has happened in these listening sessions and what the perspectives of the participants are. So with that, if we'll go to the next slide, I would welcome questions from the commissioners on the community engagement listening sessions and the key stakeholder meetings. Thank you.
So let me just jump in, and thank you very much, Bobby, for that presentation. So commissioners, we're looking now for your feedback and questions on the presentation you just heard. And if I could follow up on something that Commissioner Rocco said about wanting to make sure that there's a high level of engagement in this process. I would encourage you to be asking questions first in the form of help me understand how you will do this or how we will accomplish this. Of course, we'd like to hear your support for this plan as it's been revised based on your feedback. But if we could focus initially on questions you might have for Bobby Wunsch with regard to the plans here, we would deeply appreciate that approach here. Now, I do note that many of you still have your hands up from the previous discussion about the advisory vote. Your green check marks are checked. So if I could just ask every commissioner to deselect your green check mark right now, and then you can reselect if you wish to speak to this item, I would appreciate that, just so I have a signal of it. Thank you. I'm seeing some of you do that. And then I'm seeing some of you who I think wish to speak to this item. So Commissioner Antonio Hernandez, let me ask you to start, if you can, with your thoughts and again, questions about this, this plan as we go forward.
Actually, I'm very pleased with the changes that have been made. I think it's very well thought out. And I'm particularly pleased with the emphasis on hearing from the consumer, the people and the people who have not had access to quality medical care. I think that the report that we just approved is an excellent report from the experts, but we need to hear from the consumer. And my hope is that this process will give us an insight from the consumer, from those who have not had access. So I'm very pleased with the report. Thanks for all these changes that have been made.
Thank you very much. All right, Commissioner Shao, I see your check mark is selected. Do you wish to speak on this item? Commissioner Shao?
No, I did not wish to speak. I'm sorry.
All right. If you could deselect, then that would be great. We can't control the check marks from here, so you're on your own in terms of signaling to us that you wish to speak or not with that green check mark. Commissioner Ross, I think you're up.
Yeah, hi, Eric. And I can't recall whether this is coming up for a vote. Maybe it is, but I just want to.
It is not coming up for an actual vote, so we're really just looking for your input.
Okay. Yes, I just wanted to be mindful of some of the earlier commission comments about our role in this as a foundation, my role as a commissioner. So I just wanted to state for the record that I've recused from any of the business aspect of this grant making and stayed out of those conversations. That said, I'm generically just in full support of anything we can do to strengthen community and consumer engagement. So thank you.
Thank you. Commissioner Comsty.
So I had a number of outstanding questions that I am hoping that Bobby could make clear. Again, and this is so that we understand the process of how the co-hosts and participants are selected. You know, will the commissioners be able to provide feedback on the selection about who is selected as a co-host or participant? Will the endowment have some sort of veto power? Will they be making part of the decision making on who is a co-host, or will that fully be a function of CHHS or the consultancy? You know, well, I think it's really important that we get public feedback and commissioner feedback on the selection of these groups, because if there are folks in these communities who don't agree with the co-hosts who are selected, or don't believe that the participants accurately reflect their community, we should know that. And generally, with respect to the process, you know, I really want to urge us to make sure, and I don't think this is the intent, but you know, with processes like this, it could just be turn into some type of performative engagement with marginalized communities, and we don't want that type of you know, check mark box type of engagement with communities. And you know, we don't want to replicate paternalistic relationships between nonprofits and the private foundation world and the government. So with that in mind, I want to make a specific recommendation on to include community-based activists and organizing groups, community-based organizing groups that have membership in the populations, and not just groups that speak on behalf of these communities. And I want to make the specific recommendation to invite Black Lives Matter Los Angeles to co-host and participate in the process. Black Lives Matter Los Angeles is working on healthcare issues in Los Angeles, in Southern California right now. And I think it would be very important to hear that voice and to include that, the voice of Black Lives Matter in this discussion.
Great, thank you. Thank you, Commissioner. Commissioner Maria.
Yeah, I just want to first of all say thank you to the consultants for opening this up, the process of engaging like this. I really appreciate that, and for soliciting feedback on different groups that we can invite. As Carmen says, I think it's actually very important to pull from the margins of people who aren't in the NGO, nonprofit, industrial complex that California Endowment has good relationships with. I think that it should be total. I'm actually, the whole process of transparency is really, the lack of transparency has been very distressing to me, and makes me feel a little bit like this entire process is very performative. So I just want to, because the stakes are so high in this process, I want to ask that as much could be as transparent as possible. The consultants have an extreme amount of control here. Words that we have put in for various reports don't show up. Feedback is sort of cherry picked and put into these reports. And again, there's no time for the commissioners, so many brilliant people on this commission with such vast experience and different perspectives. And then we're given 15 minutes to comment on things publicly and no time to get together to really debate and to sit together and to hammer out our thoughts and beliefs about which way we should go forward and how to best and most effectively do this. So while I respect and appreciate the time that the consultants have dedicated, the effort, I can see the great work that you guys have done, and I don't mean to undermine that. I'm saying that this process is still extremely problematic. And what will happen, as happened structurally in our government, is that the voices and perspectives of those that are crushed by the structures of our society will remain crushed. And I can see that in the report. And so I just feel like, thank you. I would like to know who is being invited to the table ahead of time so we can have a process to veto or offer, feedback on that, so we know that we're getting the right voices in there. And I don't want to hear about it after the fact in a report presented to me that I get 10 minutes to comment on. Thank you.
Thank you, Commissioner. Bobby, did you want to respond to anything that you've heard so far from commissioners?
Yes, I'd appreciate that. Thank you. And I just want to say a few words about the selection of the community organizations. First of all, we'll be working collaboratively with the California Endowment, the Health and Human Services Agency, and of course the consulting team to use the selection criteria to identify the most able and effective community-based groups to co-host these listening sessions. And if any of the commissioners, and Carmen has provided an incredible list, as Dr. Myra, of possible both participants and co-host organizations, if any of the commissioners have ideas about who some of those co-hosts might be, I would certainly appreciate getting those. And we will vet those with the California Endowment and the Health and Human Services Agency against the criteria as we choose the co-hosts, and use those lists to invite participants to the groups. I really appreciate Carmen's suggestions about community-based advocacy groups and activist organizations, and they will certainly be included as we look to identify both co-hosts and community residents and community members who will participate in the listening sessions. We will certainly let the commission know who have been chosen as the co-host organizations.
Great, thank you, Bobby. Commissioner Schneider, I see you've indicated you want to speak. Go ahead, please.
Yeah, just very, very quickly. I like the plan, and the only thing I'd suggest to us all and to the staff is, in terms of the stakeholder sessions, when you get there, I think you should look for the most virulent opponents. I mean, coherent, but I think we need to know exactly what the other side is saying, so that if they have any colorable arguments, they can be addressed in the final report.
Mm-hmm. Thank you. Anthony Wright, Commissioner Wright, I see that you also wished to speak.
Yeah, I mean, I think a couple of things. I appreciate the focus on community engagement and getting a broader cross section with a focus on the least advantage. And so in that vein, I think the focus on racial and on the making sure that we get a range of the racial and ethnic diversity of California is incredibly important. I would also think for this report that it would be useful if we broke it down, now that we've been unmoored from the geographic focus, which may be both the curse and the benefit of our now virtual lives, that we focus on how people interact with the system. So have it maybe be a focus group of Medi-Cal folks who see this from the point of view of being Medi-Cal recipients, of being actually uninsured, of being of being in certain situations. I do like the fact that we have people with I would want some people who have chronic conditions who experience the healthcare system on a daily or weekly basis, which is a very different experience than those people whose main interaction with the healthcare system is that they have a card in their pocket, in their wallet. And so I think that there's opportunities for there. And in some of those cases, there's not necessarily like a group that obviously caters to that as a group. But I do think that if the point is to get feedback about how people experience the healthcare system now and how they would experience benefit, want to see in a transition, then maybe those are some other categories to look like. I know that there's 15 different, that there's literally a million ways that we could split this up, but I think that's another way to do to look at it that could be useful. And then I also just think in terms of the actual questions, we would, I think that I think the commission, as we had feedback on the version last time, as we develop those questions, those are going to be very important, and we would want to have some feedback on that, especially because I do think it's different, and you'll get a different response if you have open-ended questions versus if you're having folks, especially lay people, respond to specific proposals where they could really maybe get a little bit more granular and maybe more helpful to the report that we're trying to produce to actually get to a single payer system. Thank you.
Thank you, Commissioner. And just again, Bobby, just to reiterate what I believe you've said, and I believe is true, is that commissioners will get lots of opportunities, I think, to both give feedback to the questions, such as you just suggested, Commissioner Wright, continue to suggest who will be taking part in these groups, as well as be invited to observe and make sure you're able to see what's happening in these groups. So Bobby, I don't know, we have a speaker, Director Commissioner Chin Hansen, who wants to speak, but Bobby, I don't know if you want to just reaffirm or perhaps edit and modify what I just said in terms of the level of transparency and feedback that we're hoping commissioners will engage in.
No, I think you said it well, Eric. Thank you. I'd prefer to hear from other commissioners. Thank you.
So Commissioner Chin Hansen, you've indicated you want to speak.
Yes, I just would like to offer another resource that recently was deployed. We have a simultaneous effort going on in the state called the Master Plan for Aging, and that was begun in the summertime. And in that process, there was also a concerted effort to go up and down the state, both in cities and in rural areas, to hear the voice of people from the community directly. And so I just wanted to offer you that resource, that some work was done, is particular with an older population on the issues of healthcare, as well as social access, which of course broadens this beyond medical care access. But just the fact that this work was done and may be a helpful backdrop for a given population, because it was directly going to the community.
Thank you, Commissioner. That's very helpful. I've made a note of that. So that's great. Thank you. Commissioner Scheffler.
Yes, I want to tell Bobby that I'm really pleased at what she's doing, and it's going to be an important contribution to our deliberations. I'm particularly interested and would have her look for people who are left out of the system and disadvantaged. I really want to hear from them. This is not a random sample of California. I want to hear from the people who are having the most problems with the system and why. And I'd like to hear from them and perhaps others about what their ideas would be to improve it, so we can consider it in our deliberations.
Great. Thank you, Commissioner. So I don't see any new check marks or indications. Don, I see you waving a hand at me. Okay, go ahead. Can you unmute yourself, Don?
Am I unmuted?
Yes, you are.
Great. Sorry, my check mark seems to allow me to vote for things, which I'm not entitled to do anyway, but not flag a comment. I just wanted to mostly think this is in support of a comment that Commissioner Wright made. You know, really important to bring folks from a diversity of backgrounds and perspectives, but adding to that list are the 16 million Californians who get their health care through the 3 large programs in California, and those are Covered California, CalPERS, and of course Medi-Cal. The landscape that was just approved by the commission to move forward to the legislature and the governor, I think, lays out a bunch of really important issues and some really, I think, helpful and thought-provoking suggestions about how you capitalize on those programs and sort of setting a framework for the possibility of integrated financing. But you really need to hear also from the folks who receive their health care through those benefits and get a better sense of what really matters to them, what works for them, and answer questions about the continuity of their healthcare through this whole process. So just a pin in that one as well.
Yeah, thank you. Commissioner Rocco.
Thank you. I have a comment about the listening sessions and more of a question about the stakeholder meetings. In terms of the listening sessions, you know, obviously there's great interest in having things be transparent. And I just want to, at the same time, remind ourselves that the folks who we are trying to hear from don't need to be people who are accustomed to public speaking. We're going to be asking them potentially sensitive, personal questions. And that's an odd thing to do in a public setting where everybody can listen to it. And I think we need to be very sensitive in the planning of how to make that work for the people who are participating in those sessions, so that they do feel like they're able to talk to each other and share stories and not sort of feel like they're on display. I mean, it's a very different dynamic than what most folks would be accustomed to. And in terms of all of the discussion, I agree with the other commissioners about making sure that we do outreach to all of the communities that need to be represented here. And this is probably part of the plan, but we haven't mentioned folks who are homeless, folks who are part of the LGBT community, people who are disabled. So just making sure that that's you know, amongst the individuals that we're reaching out to for participation. In terms of the stakeholder meetings, I do think that as was done a couple months back, it would be helpful to the commissioners to have a list of who you're proposing participate in the stakeholder meetings, so that we can take a look at it and help think through if there's anybody who's missing. So I would just put that out there.
All right, thank you, Commissioner. And thank you, commissioners. I believe that no one else has indicated a desire to speak at this moment. And so I'm going to turn it back over to Karen Bloomer to facilitate public comment on this item.
Thank you, Eric. So once again, we're going to invite public comment through a variety of means. We'll be opening up the chat feature for written comment. Of course, the email address remains open as well. And we'll be inviting members of the public to use the raise hand feature to join the queue to speak. And so I will now be looking over to the participant panel. And I'm going to invite Eric Vance to unmute himself, please. And if you could note your association if you have one. Thank you.
Hi, can you hear me?
Yes.
Hi, thank you. My name is Eric Vance. I work for Healthy California Now. It's a statewide coalition advocating for single payer. I agree with Commissioners Comsty and Dr. Myra and thank them for their earlier no vote on the environmental analysis. I feel these community engagement sessions are unnecessary, a delay tactic, and a potential excuse to not move forward on single payer. You're still working from a pre-pandemic timeline and bureaucracy. My primary concern is that the audiences won't sufficiently be educated by the session organizers or hosts on single payer. I ask that you allow single payer advocates to develop material for the sessions, including direct language from the few commissioners who do vocally support single payer. Even if the meetings are ideally diverse representations of working class communities, the issue is that consultants and the majority of the commission are already biased against what hundreds of members of the public have already overwhelmingly demanded in these meetings. Single payer can get whatever results they want by how these meetings are framed and what material is presented. If the meetings don't prominently feature single payer, they are essentially selling snake oil. We are the community currently and repeatedly telling you during these meetings right here and now and in our emails why single payer is the only way forward to address healthcare justice and racial and socioeconomic disparities. That being said, if these are going forward, I do request that the Healthy California Now Coalition has a role in these. We have statewide organizations full of frontline healthcare workers, experts on policy, and working class advocates. But again, you've already heard from the public overwhelmingly that they want single payer. These sessions are just another way to potentially avoid that. Thank you.
Thank you, Mr. Vance. Bill Honigman, we invite you to unmute.
Hi, can you hear me?
Yes, sir.
Okay, thank you. Yes, my name is Bill Honigman. I'm a retired emergency room physician from Orange County. Thank you, commissioners, but we don't have time to talk about how we're going to talk about getting to a single payer system or what you're calling a unified financing system. This needs to have been done yesterday, not today. Californians are dying now due to COVID-19 because they have significant financial impediments to getting tested, contact tracing, or treatment, especially in the hospital, ER, or ICU settings, likely because they fear financial and cultural repercussions that would be overcome with adequate public financing and allocation for resources like adequate facility staffing, personal protective equipment, and other services related to COVID-19, as well as ongoing medical problems that themselves increase the risk of complications due to the virus. The time has passed for academic discussions and cordial disagreements. It's time to take the welfare of we the people, who are the real stakeholders in California's healthcare system, and move forward with legislation now to start a single payer system in our state before even more preventable deaths and unnecessary suffering takes place. Thank you, and onward.
Thank you so much. Lynn Heidecopper, we invite you to speak next.
Hi, my name's Lynn Heidecopper. I'm with Healthcare for All Santa Clara County. I've been working on single payer for the last 20 years. And like the other pro-single payer people, we're in an urgent situation. I was going to add 2 groups to the sessions, the community groups. One is the mentally ill. No one's mentioned the mentally ill, and that's a very serious problem. And the other is the people, like Bernie Sanders said, the underinsured, the millions of people who can't afford the Affordable Care Act. It's the Unaffordable Care Act. And they delay care, especially the pandemic, because they're too afraid to see a doctor, get evaluated, because they're going to get a bill. And that's why it really is urgent that we transition to a unified, you know, if Canada can do it, all the other countries, it's ridiculous that we can't. Thank you.
Thank you very much. Yusra Hussain, we invite you to unmute. We hope we can hear you this time.
Okay, can you hear me now?
Yes, welcome.
Okay, perfect. Thank you so much for having me. So my name is Yusra Hussain. I'm a physician, practicing physician in Palo Alto, and I'm also the head of the Physicians for National Healthcare Program in South Bay. As you can hear from my title, I'm for pro single payer healthcare system. I totally second all the speakers who are in support of the single payer healthcare system. I mean, it's actually to some degree, it's incredulous to see that, you know, we have a panel on commission, Healthy California Commission, with 70% of the public in support of a single payer healthcare system, as has been very well demonstrated by the support for Bernie Sanders in our election, in our primary election. Yet, unfortunately, this panel of commissioners have voted in strike with the lack of support for any bill currently in proposal for single payer healthcare system. This is really shameful because this is really not a representation of democracy that I came to cherish, being, you know, an immigrant and, you know, living in the United States, hoping to see, you know, execution of what we expect to be of democracy. Yet what we see here happening right now is disgrace really to democracy, as 70% or more of Californians really want to have a single payer healthcare system, yet none of our representatives so far that I've heard from, except for Commissioner Rupa Maria and Commissioner Comsty, who I really thank very much for being standing out there,
Thank you, Dr. Singh.
as Sawthorn, you know, to speak the voices of the public, you know, and in defense of single payer healthcare system. I see people dying every single day in my practice for lack of access to healthcare.
Thank you, Dr. Singh.
I see homeless people. So I really urge you guys to reconsider your position, because it affects human lives. And it's really, I would say everybody who speaks against single payer healthcare system at this point, I don't know how they can sleep at nighttime, you know,
Thank
with
you.
a
I do need
clear
to let others
conscience.
speak. I'm sorry to interrupt.
Thank you very much.
Thank you. There's just so many hands up. Thank you very much. Sonia Vasquez, we invite you to speak.
Thank you so much. Can you hear me okay?
Yes.
All right, thank you. My name is Sonia Vasquez. I'm with Community Health Councils located in South Los Angeles, but we are a public health advocacy organization across California. We, I appreciate this opportunity. You know, there's a couple of, I know I have less than a minute at this point, but just really quickly, I want to be mindful that, you know, as we've seen on this call already, technology is a challenge, especially in our under-resourced communities. So if there's an opportunity for us to really think beyond just these Zoom calls, working with community-based organizations to see how we can engage our residents, our stakeholders, you know, surveying, key informant interviews, whatever, or providing information that we already have from our communities would be great, so that we can make sure we have the most representation as possible. We are challenged sometimes, I think, on these Zoom calls, especially with interpretation, with breakouts and all of that. Also, as an advocate that's really trying to get caught up and appreciate all the information that you, all the stuff you all have on the website is great, but it is not translatable for communities. And so I think, you know, as advocates, as community-based organizations, we're doing our best to try to figure out how to distill this information and provide it into the community. So as much as we can work together to figure that out, we'd really appreciate it. Thank you.
Thank you, Ms. Vasquez. Corey Rosella, we invite you to unmute.
Hello, this is Corey Rosella from the Western Center on Law and Poverty. I have a couple of points that I'd like to make in support of some issues that Commissioner Rocco raised. I think that it is, these conversations are very sensitive and private, and we would like to make sure that people do have their privacy protected. I also have a question about the demographic information collected, and I'm wondering to what extent you are incorporating the voices of undocumented Californians and how their privacy will be protected. And to also support what Commissioner Wright said, we know that 25% or more of Californians are on Medi-Cal, and having coverage isn't enough. And I think it's really important to focus in these groups. What are actual barriers to care? What are the issues people have accessing care?
5 seconds.
Thank you.
Thank you very much. Maureen Cruz, you're up next.
Thank you very much. Yes, I would like to know who speaks for the dead. Since the Yale study, we now know that it's far more people die every day in California than had been previously documented, probably about 17 people a day, at least, at minimum. People go bankrupt, people lose their homes, communities become devastated in the system that we have now. This is urgent. These deaths occurred before COVID. There have been many, many polls. I don't see the need for polling anymore, especially in the polls are self-selecting. When you have groups of people showing up, you only get those who are literate and who have the availability to show up, which would probably not include the undocumented. We already can see by outcomes, everyone on this call, on the commission, is some kind of a researcher. You know that you look at outcomes. When we look at our outcomes, we understand what is going on in populations. Money is driving this process, and it is also giving cover to the legislature not to act. The very first thing that we need to do is enact legislation through the legislature. And this is a delay and diversion process, and I'm really sad to see it continue in this way.
Thank you, Ms. Cruz. Beatrice Sosa Prado, we invite you to unmute.
Hi.
Hello.
Good morning. My name is Beatriz Sosa Prado. I'm the Executive Director of California Physicians Alliance. CAPA is a 501c3 nonprofit or statewide organization with thousands of supporters consisting of healthcare providers, public health advocates, and pre-health and health professional students across California who support single payer, Medicare for all, and universal healthcare. I appreciate this opportunity to provide public statement on the community engagement section. CAPA supports the commission and looks forward to continuing to engage in meaningful discussion with California's leaders and communities throughout the state to move forward toward a unified system of public financing, single payer. CAPA has extensive experience with organizing, hosting, and moderating discussion groups, technical savvy, including the Zoom platform, and we are bilingual in English and Spanish. These are just some of the strengths that we bring to the table. And we're more than glad to provide support for the co-host organizations that are well connected to diverse, racial and ethnically, income, gender, workforce, ages, etc. communities of California. We kindly ask that CAPA is strongly considered. Thank you.
Thank you. Thank you very much. Michael Leidy, we invite you to unmute.
Thank you, Michael Leidy, Healthy California Now, and the Sanders Institute. I want to follow up on comments by Commissioners Costi and Myra, in particular on the conflict of interest question. I would urge the commission to publish the funding sources for all the consulting groups that are involved in this, so that we have on the commission website the exact funders for all these organizations that are so influential in this process. Secondly, how can we insulate the community organizations and advocates from the Cal Endowment? I understand Commissioner Ross has excused himself, but the California Endowment has had literally billions of dollars of resources, decades of work, and has done nothing to promote unified financing or single payer. So any undue influence by them is highly problematic in the selection and constitution of the community engagement process. And finally, I would urge you to publish the Form 700s for all commission members on the website so that folks can easily access their conflict of interest or potential conflict of interest records. Thank you.
Thank you. Maribel Nunez, we invite you to unmute.
Hi, everyone. Can you all hear me?
Yes.
Hi, my name is Maribel Nunez with Inland Equity Partnership, and we convene the HHS Network, and we are a member of Healthy California Now and amongst other coalitions, Health for All and others. And we do feel that we did get enough input from the community, and we have a state Senate support for SB 562 that we just move in that track of legislation to go to the assembly side for single payer. So we're definitely in support of trying to move things forward, and I appreciate the attempt with the commission, but can we move forward already with the legislation? And we're an economic racial justice organization. So if there are convenings or events happening, then we could definitely help with co-hosting and across the state, particularly Inland Empire or Coachella Valley or Imperial Valley, because you're gonna hear from the immigrant communities, you will be hearing from other anti-poverty groups. I would even say some unions.
5 seconds.
Saying that we need a single payer. So please make this inclusive in the process of convenings. Thanks so much.
Thank you. Linda Perez,
Oh,
you're up next.
thank you. Okay, so I have two issues here on the participation of people to protect their privacy. Somebody was talking about privacy. I would like to suggest to send a letter to the people that lacks healthcare mainly. And that would, you know, a series of questions, and if they want to participate, you can have that in writing and with a comment of why they need this. This is such an important issue for so many people that have no access. And also, I was going to ask you, what are you going to do to help the homeless community, which is so devastating and so large? Thank you.
Thank you very much. Thank you. Benjamin Tran, we invite you to unmute.
Hello, Commissioners. Benjamin Tran again with CPEN. Just wanted to continue to express our support for the focus and attention on understanding how low-income, disadvantaged communities of color and rural communities view the problems and potential solutions being discussed by the Commission. We believe the purpose should be to encourage the state to design a program that is patient-centered and designed by the consumers and the communities that would use it. Some of the concerns that we do want to continue to center is if the Commission will be recruiting limited English proficiency populations, will these be conducted in multiple languages or formats that are accessible to them and the people with disabilities? So really interested in seeing if these concerns can be addressed or addressed at some point.
Thank you very much, Mr. Tran. Margaret Copey.
Hi.
Hello.
My name is Margaret Copy. I'm a member of Physicians for a National Health Program, as well as Healthy California Now. I'm a psychiatrist in the Bay Area. Regarding financing, we need to consider both saving money as well as raising money. In terms of saving money, the cheapest way to cover everyone is with one risk pool and only one payer. Also, only one benefit plan. This also addresses equitable considerations, because once you introduce multiple plans, you have an underserved underclass. And that's one reason why Black Lives Matter and the Poor People's Campaign and NAACP all have single payer in their planks, in their demands. So one benefit package, one billing form, simplified documentation, global budgets. Ooh, I have a lot more to say. Global budgets, fee for service, risk sharing plans have not saved any money. Also we need to concretely plan to overcome the obstacles for combining our funding streams, such as ERISA and the GAN Act and the VA, all the elements. There are solutions. We just need to make a plan and then start working on it.
Thank you very much. Thank you. So sorry, we do have more hands and we're running out of time, but thank you for your comments.
Okay.
Art Persico, we invite you to speak. Art, can you unmute yourself, please? There you go.
Can you hear me?
Yes, sir.
Okay. Yeah, my name is Art Persico. I am with the San Francisco Gray Panthers and the California Progressive Alliance. I'm concerned about the lack of transparency by the consultants in this process. The public, commissioners, and nonprofits' input to the consultants should be made public without compromising privacy. The role of money in lobbying elected officials should be examined by this commission to determine if there's a perverse role that holds them back from making decisions in the public interest and for the common good. And finally, the hearing process could be problematic if the co-hosting organizations and consultants have a coincidence of interest in their views, values, and interests that skew the results. Thank you.
Thank you very much. And we'll take these last two public speakers, first Perry Briskin and then Matthew Snyder. So first Perry Briskin.
Hi everyone, my name is Perry. I'm from UAW 2865, the Student Workers Union of the UC system. And I just want to urge that students be involved in this process. The UC system alone has over 280,000 students. Our union represents 20,000 student workers. So would just love for that to be considered. Thank you so much.
Thank you very much. And lastly, Matthew Snyder, I invite you to unmute. Mr. Snyder, if you could unmute yourself, please. There
Can
we
you hear
go.
me?
Yes.
Yeah, thank you so much. I think we're taking turns muting me. So, so my name is Matthew Snyder. I'm the director of the 28ers.org. We work on the need for public financing for 28th Amendment to U.S. Constitution and exclusive public financing for all elections. We are deeply involved in the SB 562 fight for single payer. And as of today, we've now lost 10,340 people since the shelving of SB 562. And so the need is ever more urgent for health care for all people in California. It is a racial issue. It is a gender issue. It is an identity issue that transcends all other aspects of our lives. It's also the most expensive, other than housing, cost for people in California. We don't need more commissions. We need to actually step forward and actually put forward a unified financing bill that creates a path for single payer. Thank you so much.
Thank you very much, Mr. Snyder. And with that, we conclude public comment. And Dr. Chen, we suggest now that we take a 10-minute break. Everyone should, stay logged on and logged into this meeting, but we would like to take a 10-minute break and return just before
Karen?
11 a.m. Yes.
So I'm just going to make a couple comments before
Wonderful.
They're great. Thank you. And so just thank you to Bobby, to the commissioners for your comments, and particularly for the public. I do want to make 3 brief comments. One is, as a primary care physician who spent my entire career in community health centers and in public hospitals, taking care of uninsured and Medicaid patients, the sense of urgency, particularly as I deal with COVID, really resonates. California is an incredibly large and diverse state. We have 40 million people, as many of you have pointed out. 20% of our residents are limited English speaking. We have undocumented. There is a real need to make sure that all voices are heard. And unfortunately, we can't do simultaneous interpretation during this commission meeting. But again, we do need to make sure that that all of our diverse communities are engaged. The second point I want to make is a clarification, is that the California Endowment does not have any role in deciding which organizations are going to be involved. This is the role of the California Health and Human Services in consultation with our consultancy team. I will say that, with some of the concerns that have been raised, which I think are really important to hear out, TC did offer to step back and withdraw from the process. And we actually gave that some consideration. And in the end, because we think this is so important, that particularly in the context of COVID, making sure that diverse voices that oftentimes aren't at the table, who aren't initially involved in the political process, are engaged. We decided we want to move forward and try to navigate all of the different concerns. And again, part of this issue is balancing process with pace, and really figuring out, how do we do this responsibly, but how do we actually do it in a way that actually can then inform our discussions and deliberations. And then the last point I want to make is commissioner input is a given. We value it. It is critical. Everyone knows that the charge of the commission is to study this issue and produce 2 reports. And I will say that there are 18 commissioners. There are 12 voting members, 5 ex officio members. Our intent is to really leverage the full extent of expertise and opinions and perspectives. People were chosen because of their expertise, because of their vantage points and representing different stakeholders. No one commissioner has veto power or say in terms of what happens. But again, we need to figure out a process where we can get everyone's input in a fair and transparent and thorough way. So with that, I just want to thank everyone, particularly again, like the more than 200 members of the public who are with us on this process and discussion and journey. And we're going to take a, I think, 10-minute break, you said, Karen?
Well, yeah, I wonder if we're actually...
0.7. I'm sorry, I spoke
no,
for too long for those people who need time to get to the bathroom.
Not at all. Those are very important words. I do think we should probably start back up at the top of the hour at 11 a.m. So that gives us 7 minutes, and we'll reconvene then, if that's all right with you.
We'll see everybody at 11 o'clock then. Thanks.
Thank you.
So commissioners and Alice, Dr. Chen, I think as we get past the top of the hour, we perhaps could turn it over to you, Dr. Chen, to introduce the next segment in our agenda.
Oh, excellent. Welcome back, everyone. I'm very much looking forward to the second half of our meeting. As several of the commissioners noted, we really haven't had the desired time and format to really have a robust discussion and engagement among the commissioners, and this is what we're hoping for the next segment. I did want to thank Dr. Rick Kronick for a really clear and informative set of materials, which will serve as a foundation of our discussion. And again, the goal of this next section is to really solicit ideas, engage each other, and hear reactions around designing a financing scheme for unified financing. So with that, I'd like to invite Dr. Rick Kronick to present. Thank you.
Thank you so much, Dr. Chen. Good morning to commissioners and to the public. I'm also excited for the next couple of hours. I want to start by thanking commissioners for your thoughtful questions and comments that many of you submitted in response to the pre-recorded presentation that I hope you all have had a chance to view. These questions and comments really are what we need to make our work better. In particular, I want to thank Commissioners Comsty, Chin Hansen, Fox, Shao, Moulds, Scheffler, Schneider, and Woods. Really, again, very helpful feedback and questions. I will try to answer as many of your questions as I can in the next 10 minutes, but if I don't get to them all, there'll be time to raise them in the breakout groups, and if there are still unresolved questions, we will follow up after the meeting. I'm going to very briefly summarize a little bit of the material in the pre-recorded presentation, particularly discussing the criteria to evaluate the suggested criteria to evaluate revenue options, which will be the subject of your discussion immediately following my 10 minutes, and then a very brief overview of the broad-based revenue options themselves, which will be the subject of the breakout sessions. Next slide, please. I do want to start with one context setting slide. So this slide shows $197 billion in 2019 spent by employers and households on care in California. This is part of the, little under half of the $437 billion that's spent in healthcare altogether in California. The other, half mostly being federal and state spending. We're going to assume that the other half, the federal and state spending, will continue at their current levels. Those programs will change as they become part of unified financing, but that the money will continue. Obviously, that's a sort of bold assumption, and much can be discussed about it, not the subject of our discussion today. This 197 billion, the kind of non-federal and state part, is the money that would need to be replaced if employers and employees are no longer directly purchasing insurance, and if individuals are not purchasing insurance, and if out-of-pocket spending declines. Not all the 197 likely needs to be replaced. To the extent that health spending declines as a result of unified financing, there are savings from creating unified financing, we won't need to replace the entire 197. A variety of estimates suggest that savings in the 3 to 10% order of magnitude might be possible. On a $437 billion base, that's savings of between 13 billion if it was 3%, or 44 billion if it was 10%. So, maybe we would only need 184 billion, or only need 154 billion. For the purpose of the discussion today, I ask you to bear with us that even without knowing exactly how much money is needed, I'm hopeful that you can have a fruitful discussion of the criteria that could be used to evaluate potential options and of the potential revenue options themselves. One other comment on this, one of the commissioners asked a question, how much of this money, of the employer money, is coming from federal and state governments? The employer part of this is about 100 billion, about 25% of that is from federal and state and local government, so about 25 billion, more or less. It would be a mistake, though, I think, to think that that money is necessarily going to be available for unified financing. As I discussed in the presentation, and as I think most of you know, the employer money should probably be thought of as part of workers' compensation. And if employers are no longer directly contributing to health insurance, that money should arguably go to workers. Next slide, please. So as Eric will discuss in a few minutes, today we'll be asking you to provide feedback on the suggested criteria for evaluating revenue options. We suggested 7 for them on this slide, 3 on the next. Didn't receive questions about this at all, except one about the sort of do no harm part. That's a little complicated part, so I'll spend a little bit of time on that. Equity and adequacy, extremely important, pretty straightforward. The do no harm, to the extent if employers stop contributing directly to health insurance, then hopefully there would be $100 billion increase in workers' wages. For collectively bargained folks, that might happen through bargaining. For other folks, not so clear. Emmanuel says, and Gabriel Zuckman, economists at UC Berkeley, have suggested that the state should pass a law that would require employers to pass that money on to workers in the form of a wage increases. So if an employer is paying $6 an hour now for health insurance, every worker would get a $6 an hour wage increase. To the extent that that happens, federal payroll and income taxes would increase by about $30 billion for the employer part and more for the employee part. And while the state could argue, and I'm sure would argue, to try to get that money back from the federal government, that's likely to be an extremely hard argument to win. Next slide, please. And then the final 3 criteria here, stability, simplicity, and to using tax policy to try to discourage corporate behavior that contributes to poor health and individual behaviors that contribute to poor health. So those are the 7 criteria. We'll be asking you to discuss those and in particular suggest criteria that we may have left out. Next slide, please. I want to move now to a brief reminder of the broad-based financing options that I covered in the pre-recorded presentation. The 5 options here are listed, and we've got 5 slides coming behind this with each of them. You might ask, why these 5? The answer is they were the only 5 that we could think of that would could plausibly be used to generate fairly large parts of the money that's needed. And again, we don't know how much money is needed. We're starting with 197 billion, maybe we'll go down to 155 billion or 180 billion, but it's a lot of dollars. These are the only 5 we could think of that could get somewhere close. There are a variety of supplementary, what we call supplementary financing options. And a question was asked, can you provide more information on that? We will do that as a follow-up. I'll just mention a couple now. A surcharge on incomes over $1 million. If there were 1% surcharge on incomes over $1 million and 3% surcharge on incomes over $3 million, that would raise an estimated $4.5 billion a year. There are a variety of exemptions from corporate taxes. One estimate of closing many of those exemptions could potentially raise $6 billion a year. A tax on unrealized capital gains could, on a steady state basis, raise around $3 billion a year. these supplementary sources, you know, if a lot of them were stacked together, could maybe get up to 20 billion or maybe 30 billion or maybe even a little more, depending on kind of how aggressive the person were. So it's not zero. But again, if 150 billion or more is needed, probably can't fill in the big part of that. Next slide, please. And so then very briefly, because I have 2 minutes left, we have 5 potential broad-based financing options that you'll be discussing in the breakout sessions. A question was asked, you know, for each of these options, there are exemptions and phase-in approaches that could be considered? And the answer is certainly yes. So, you know, the first option here is a payroll tax. There are a whole variety of ways to do this. Small businesses that aren't offering insurance now could have a phase-in. Small businesses could be exempted entirely. You know, each of the exemption parts have their pluses and minuses. And you know, if you exempt businesses with less than $2 million of income, strong incentives for a $4 million business to turn into $2 million businesses. But you know, all these kind of considerations could be looked at. The main story here is a payroll tax would be much more equitable than the current head tax system, because it would scale contributions to income rather than having the same amount for every person, and retains the federal tax advantage that I talked about a couple of minutes ago, that federal payroll and income taxes wouldn't increase, or wouldn't, and might even actually decrease. Next slide, please. Second possibility is a new possibility. This is or new to me, and doesn't exist anywhere in the United States at this point, suggested by Manuel Saez and Gabriel Zuckman at UC Berkeley, that would extend the payroll tax to all forms of compensation, so not just to wages, but to other forms of compensation, as well as to corporate income and to interest income. So here, you know, it's a much broader base, so a 1% tax raises quite a bit more money. This is a new approach and is clearly broader financing system than base than we currently have. Next slide, please. Gross receipts tax on business revenue. Big advantage of this is that a 1% gross receipts tax raises 40 billion a year. 3% would raise 120 billion a year, an entirety of employer and employee payments for health insurance right now. So it's got the sort of attraction that low rates raise a lot of money. The difficulties are that this is quite regressive. Lower income people are going to end up paying a much larger fraction of their income in the gross receipts tax than upper income people, and that has at levels of 2 or 3%, and maybe even smaller levels, would have big concerns about distorting firm decision making. So the example I gave in the presentation was that if a farmer sells her crop to a small distributor, she pays a 3% tax. The small distributor sells to a large distributor, another 3%. The large distributor to the supermarket, another 3%, and the supermarket to the consumer, another 3%. So the consumer is paying a 12% tax, so that kind of adds up a lot. And also then the supermarket has strong incentives to try to buy up the supply chain, which creates lots of other kinds of concerns. Next slide, please. Sales tax could be extended to services. As you know, we tax goods. We have a sales tax, 7.25% state sales tax on goods. We don't have a tax on services. This could be extended, and you know, if it were extended to the services, excluding those on these slides at the 7.25% rate, would an estimated 50 billion. It is regressive, and this, like the gross receipts tax I should have mentioned on the last slide, has the big concern that if employee wages increase by the 100 billion that employers are currently spending, the first thing that happens is that 30 billion of that goes to the federal government, and that does seem like a problem. And then last slide, please. California could have a broad increase in income taxes. Income tax is the most progressive part of our tax system. To raise, $100 billion, we would need to double current state income tax, which would be a heavy lift, obviously. And like the gross receipts tax or the sales tax, would have the effect of increasing federal payroll and income tax revenues and creating that problem there. Last comment is that I hope that the presentation that I recorded, and it'll be interesting to see where your discussion goes, leaves you with the notion that there are feasible ways to finance unified financing in California. Some people might look at it and say, and I know in Vermont, the financing was part of what made it hard to go forward. But there are, I think, ways to make this work. And I very much look forward to hearing your discussion and any further questions, both about the suggested criteria, and also about potential revenue sources. And I'll turn it back to Eric.
Thank you very much, Dr. Kronik. So, commissioners, I do want to try to keep the next section of our discussion focused. And so in a moment, we're going to go to breakout groups where we can have a discussion about all of the things that Dr. Kronik presented in his presentation, including these revenue raising options that you just reviewed. But initially, I would really like to keep the focus on this slide and on these 7 criteria and pose the question to you whether you think there are any missing criteria or whether these criteria seem complete and good to you in terms of how you would weigh different financing options. And so any comments on the financing options themselves, let's hold until after or during the breakout groups and after the breakout groups. But let's for now just ask the question, to what extent do you think this is a good list? And to what extent do you see missing criteria here? So again, I would ask you to use the yes check mark to indicate to me that you wish to speak. And I would like to hear from you for the next 10 or 12 minutes before we go to the breakout groups right at 11:30. So Jim Wood, I see that your check mark was on, so let's just go ahead and start with you.
Yeah, I think for me, first of all, it's a great list, and I think there's a lot of information here that we will have. I'm sure we'll have a very robust discussion. But I think one of the things that is missing that we really need to discuss is how will we deal with increased costs over time, and that has an impact on what we ultimately choose for a financing mechanism, because healthcare costs are going to continue to rise. And so that was a challenge that they were never really able to deal with in Vermont. And that's why they were not successful in coming up with a financing mechanism. Because if you have to continually go back and ask for more and more and more money over time, there is that creates a challenge with the people of California or anywhere going through there. So, there's a bigger, broader part of this that I think is important, but it's unrelated to this, and that is cost. How do we control costs? If we can control costs, then the need for this other component is minimized. But we've got to find a way to do that.
Great, thank you very much, Commissioner Comsty.
Yeah, I wanted to comment on 2 of these principles, which I find that they're inappropriate for this analysis. First, well, at least the way that they're framed. The do no harm principle is disturbing to me because it assumes that an increase in wages would necessarily be harmful because because they would incur federal income taxes. And I think it really fails to weigh the benefit and savings to individuals and families, both in terms of financial savings and improvements to healthcare and access to healthcare. Because if we're doing a single payer system, it would end so much harm and suffering. And that principle does not make that analysis. And it's also, it's also disconcerting. We need to address the fact that there would be money going to Social Security and Medicare if wages were taxed and when they were passed on to workers. And in the end of the day, we need to recognize that an increase of wages, recognizing that an increase of wages would be subject to federal taxes really militates in favor of looking to corporate taxes and fees to generate revenue rather than fees on workers and families. And then the other principle that I want to really push back on is the neutrality principle, because by moving to a unified financing or single payer system, we're fundamentally changing our economic structure. And we want to end the prioritization of insurance and provider profiteering over health. So we shouldn't be striving to protect the status quo economic structure of insurer, health industry, capital profiteering off of our health. And I'd be happy if a financing strategy had a net positive effect on families and working people, but had a net effect on corporations. So I'll leave it there.
No, I appreciate that, Commissioner Comsty. Do any other commissioners wish to speak to this? Commissioner Maria. Yep, I see you. Thank you.
Thank you. Sorry, I've had problems with the button. So I feel like one tax that I see missing is a wealth tax. I saw the income tax, but I didn't see a wealth tax, which I think is a way we should be talking about this with the enormous amount of personal and corporate wealth in California. I would also love to see in the gross receipt tax, there was a comment there also that this would be punishing to workers or to small industries. Those kinds of things can be structured so that industries or businesses that are small wouldn't be impacted the same way. They could also be structured, this is going to point number 7, to tax those industries that are causing the burden of healthcare problems that we're seeing in the hospital. So I just helped a 30-year-old man die of colon cancer who was a janitor at a high school who applied Roundup around his high school, the most aggressive form of colon cancer I've ever seen in my life. So we need to be focusing on those industries, the pesticide industry, the fossil fuel industry, the sugars, the soda tax, that kind of mentality. And those gross receipt taxes can be much higher than 3% for those groups that are actually causing us the health problems that we're ending up seeing in the end. So I would love to just think a lot more creatively about these numbers and about what we're willing to propose to our government.
Mm-hmm. Thank you, Commissioner. Commissioner Phlox.
Thank you. I first wanted to echo and emphasize what Dr. Wood brought up, that it is very hard to talk about financing without looking at how we're going to control costs in a unified financing single payer system. I think that is critical. It came up in the environmental scan around how much there is in terms of waste in the bureaucracy, and then just how expensive the price that everything is being charged. So I think it is really important that we keep that in mind as we talk about financing. Also agree about the do no harm principle that Commissioner Costi brought up. I think a key part of this for the labor movement is that we don't want employers to be paying as much as they do for healthcare, so that can go to wage increases. I think that's a key goal for us of a single payer system. And then I wanted to maybe flag number 7, healthy behavior. I think it is really appropriate to use tax policy to change corporate behavior, going back to the previous speaker about if there are dangerous pesticides being applied or other things that corporations are doing, tax policy and just regulation should stop that. But in terms of individual behaviors, that I think is a little bit problematic. There are so many things that contribute to poor health, like racism and poverty and multiple different things that I think having a criteria of trying to change individual behavior with tax policy, which often ends up being very regressive and punitive, we need to be careful about. And so I think it's fine to have that conversation, but having it as criteria to pick a financing system is problematic.
Thank you, Commissioner. So in the time that we have before we go to the breakout groups, I see two commissioners who've indicated they wish to speak. Commissioner Rocco first, and then Commissioner Wright, and then I'll move us into the breakout groups. So Commissioner Rocco.
Just a few quick things. I certainly agree with the speakers that are talking about controlling costs. I agree with the speakers who are talking about looking at taxes on industries that are causing health problems for people, adding cost to the system that way. And then in terms of two things that have been touched on by the consultant, there's not a lot that there's not really anything that we're looking at today that has to do with the cost savings to the system and what those would be. I looked at one analysis that said that if you go to single payer, you've got $800 billion nationwide in cost savings from getting rid of inefficiencies, which might translate to $96 billion in California. So that, we need to look at that and figure out how much cost savings there could be. And then when there was mention briefly earlier about tax expenditures that the state could get rid of in terms of tax credits, deductions and things of that nature, there's almost $73 billion in tax expenditures that we could look at, and most of those would probably stay in place. But if you could find $10 billion there, that's a lot of money. So I just think there's a lot of things to look at that are just as important as whether or not different taxes would be raised. And so I'd like to, get to a point where we're doing that comprehensive approach in addition to looking at the tax increases that are being proposed for us for discussion purposes today.
Thank you, Commissioner Rocco. And last, Commissioner Wright, please.
Yeah. No, I appreciate this discussion. At the end of the day, in an unequal economic system, then we need to go where the money where the money is, like Willie Sutton says, and that means to wealth. And so I appreciate the addition of the notion of a wealth tax. Actually, just this morning, a new bill was introduced on the subject to at least focus on our existing budget crisis, AB 2088. I would say that it is. I think as somebody who's tried to sort of be who has been in many of the conversations about trying to raise revenues to support healthcare over many years, it's hard for me not to also put a political overlay on this, where the evaluation is who could benefit from the tax change and the benefits that it funds, and who would be the opposition, and does this raise a new opposition? That doesn't mean that we wouldn't necessarily want to go for it. I would love, I think it would be good to have a righteous battle with the polluters or with another part of, with whoever will be taxed, that where I think the public can understand the dynamic about why the taxes should go for this population, whether they be the highest income or again, a corporate class that is contributing to our negative health, but also how we could also give assurances. I know, Professor Koenig mentioned in his pre-recording Senator Warren's proposal to detail getting to a Medicare for all system, and she was trying to solve a political issue, which is, can you lay out a plan that does not tax middle income folks, so you can give middle income folks an assurance that they will not be taxed? And I know that makes the problem harder, but it's hard to just say that if we have this list, there's also going to be this overlay of how does this impact, like how do we generate the support necessary to win this type of proposal. So I wanted to add that to the mechanism. And final point, I really do appreciate the comments about item number 3, and I think do no harm is just a way too broad a frame. I do appreciate the notion of how do you make sure that we can, as California is a donor state to the federal government, is there ways to design something that benefits rather than harms that relationship on behalf of California, but it shouldn't be at the expense of workers' wages?
Thank you very much. Okay, so noting that the time and trying to keep us on track, I want to briefly give Dr. Kronik a chance to just respond to any points that he has heard, and then we'll come back and we'll go into our breakout discussions. Dr. Kronik?
Thank you, Eric, and thank you all for the thoughtful and helpful comments. I agree completely with Commissioner Woods and Fox that figuring out how to make this work over time, kind of how to have expenditures increase at a rate that is sustainable is key. We'll be talking about that a lot over the next coming months. I want to focus on the concerns about the do no harm criteria. I strongly support, and this criteria is not meant to discourage that workers should get the $100 billion back that employers are now paying. But this principle is suggesting that if they get it back and then we all have to pay that $100 billion in either increased state income tax or increased or new gross receipts tax or sales taxes on services, we won't have the $100 billion to pay. We'll only have $70 billion, because the first thing that's going to happen is that $30 billion will go away. And so to the extent that revenues can be raised in a way that does not give the federal government more money, that seems like a better rather than worse thing. Still important that, I mean, the whole big part of doing this would be to change the current system in which low-income workers have a large part of their compensation going to health insurance. They should get that raise of $5 an hour, $6 an hour. I'm not saying that raise shouldn't happen. I'm saying to the extent that financing can be arranged in ways that also avoid giving a bunch of that money to the federal government, that seems like a desirable thing.
Okay, thank you, Dr. Kronik. So now let me go through the next slide, please, the breakout discussion topic. So when we're in the breakout groups shortly, we're going to ask you to discuss these 5 revenue options and ask, are there options you prefer over others? Are there pros and cons to them that we haven't surfaced that you would like to make sure are surfaced? Is there additional information you would like to see? And so each group, each commissioner has been pre-assigned again to a specific breakout group. Members of the public will be randomly assigned to specific breakout groups. You'll be able to observe, members of the public, the breakout groups in listen-only mode. Commissioners, you can control your mute button when you get to the breakout group, so make sure you're watching to see whether you're muted or unmuted. Again, members of the public will be muted automatically. Once you're in the breakout group, the facilitators will facilitate the discussion. A time clock will be visible to everyone. I note the time right now is 11:35. We intend to come back from the breakout groups at 12:15. And so we'll start a 35-minute clock as soon as you go into the breakout groups. And so with that, I'm going to ask that our host move us into the breakout groups and that we begin our breakout group session. So welcome back, everyone. Hopefully, I hope that was a very productive discussion within each of your individual breakout groups. I think because we are the first group 1, I'm going to share my screen and ask if my co-facilitator, Marian Mulkey, might give a quick synopsis of what we did in our group, and then we'll move on to group 2 and group 3, and then have a discussion about points you hear perhaps in common across all 3 groups, maybe points of difference that you hear. After we have these report outs, we'll have about 30 minutes for a group discussion before we need to close out the commission meeting. So All right, Marion, can I turn to you at this point?
This is the ultimate think on your feet task. We had a fantastic conversation in our group, and I can't do it justice, I'm sure. I will say that we began with a conversation about how important progressivity, fairness, equity fundamentally are to any approach for raising funds. And it was emphasized by most, if not all, of the members of the commission. There was definitely attention to fundamental structural reforms to tax code as it exists today, closing tax loopholes, considering whether the wealthy could be taxed again with an eye toward increasing equity in the way that funds are raised, as well as in other aspects of the healthcare system. There were some, I would characterize them as very concrete practical considerations raised around the notion of raising funds that are earmarked and put in a rainy day fund or a lockbox, how resilient to unexpected changes such as the pandemic really are those kinds of sources, and could they be truly protected? As well as a very good conversation about the political realities that Anthony Wright raised before we went into the small groups about, of course, broad-based approaches and approaches that target centers of wealth and power now are the right thing to do. The question is, are they politically feasible as well? And how many opponents or potential challenges can you take on at once in a set of reforms? I would say there was then another great conversation around structures, cost structures and cost inflationary drivers, and whether and that they must be addressed concurrently with any revenue raising, and how that can best be done at the same time. And then I'd say that we closed the conversation with thoughts about doing no harm, thinking about it in the context of not crowding out funding in essential social investments, including education, and social supports that are fundamental, and the error having been sometimes in the past that by targeting and earmarking one set of important goals, you don't leave room to make the investments in public health or in education or in social supports that are needed for true health. So I'll stop there, and I don't know if Eric, you want to add anything from our group, or otherwise when we just proceed.
No, I think you did a brilliant job, Marianne. And so I would turn to Group 2, and Bobby, are you the reporter for Group 2, or Karen? Who is the reporter for Group 2? I think it'd be Bobby.
I'm the reporter. This is Bobby Wunsch. Thank
Bobby,
you.
yeah, we can't quite hear you. Can you speak into your
hear me
microphone more?
Just adding to what Marion reported from Group 1, we had many of the same comments. First of all, I think our group emphasized as well the need for this revenue to be progressive. And also, I think there was complete agreement that this is going to need to be a combination of sources, both taxes as well as perhaps redirection of state budget items, as well as new approaches to revenue increases, plus an analysis of what the savings over time might be from a unified financing program. Also an emphasis on being careful as we look at new sources of revenues, new taxes, which ones will decline over time versus which ones will increase over time. Also, a reminder by most of the members of our group that raising taxes, as Marion said in Group 1, is difficult. There's often lots of opposition to raising taxes, and perhaps more important, 40% of any new taxes goes to education. And so how can we work within that current rule, or how can we work around that current rule? Then our group highlighted a lot of information that we still need, more information on what the savings would be, and an analysis and discussion with the commission of that, as I mentioned, which revenue sources would decline over time versus which would increase. What would the additional costs over time be that we have to make accommodations for in the additional revenues? And how much would each type of tax and redirection be, as well as what is the initial investment that's going to be needed to get this program started, and where is the income for that going to come? Two other items that were mentioned, to make sure to look at how other countries pay for their unified financed healthcare system, and what is the potential impact of the Biden healthcare proposal, should there be a change in administration, be on our thinking of California options. So I think that's the main issues. Andy, anything that I've forgotten that our group talked about?
I thought you did a great job. The only thing I'll just highlight is there was also, I think, some attention paid to thinking about tax strategies, perhaps on providers, and mentioning, for example, that certain kinds of providers like hospitals that might have tax exemptions, whether that should be re-examined, and that could be a source. So anyway, just I think provider taxes were discussed as well.
Thank you.
Thank you, both of you. And then let's move on to group 3. And Karen, are you
is
the?
Here.
All right, thank you.
I am, with Rick backing me up. So you can see our notes here. I would say there were various discussions about the pros and cons of these explicit tax options. I think rather than going into those, though, just to highlight, I think the big themes was that quite a bit of agreement that the cost savings piece is really essential here, and understanding the savings side of this equation. There's generating new sources of revenue, and there's saving revenue based on current costs that could be reduced. So both from a practical perspective of understanding what revenue needs to be raised based on an understanding of the savings and what is needed is a big piece of this. And then politically, in terms of communicating to the public and others what can be saved first, as again, a public relations perspective, our small group felt that was very important. Lot of discussion about the importance of a blended combination of revenue raising, again, an interest in obviously the more most progressive options, and just sort of keeping track of the math on what that gains us. In terms of the information that was of interest, sounds similar to other small groups. The group was interested in lessons learned both within the country, so from Vermont, specifically around sort of the communications to the public and what we might learn and avoid from where that stalled, and then other countries' lessons learned from the financing for their healthcare systems. And I would say, again, interest in understanding the cost savings, what range can we look at and feel comfortable with as a commission in terms of moving forward. An interest in using the criteria to build guiding principles that the commission endorses to use as a rubric for any consideration of revenue raising. Rick, any other things that you feel were?
Great job, Karen. Thank you. Yeah.
Great.
Yeah, and thanks to the commissioners for a really good discussion.
Yes.
So as I listen to this, and I'll be curious to hear if commissioners have the same impression or a different impression of where there's clear consensus. It appears there's clear consensus around the importance of the equity principle as kind of a paramount principle in designing whatever revenue structure we want to come up with, that it be progressive, that it be one that focuses on equity. I hear a significant consensus, if not full agreement, that an important component of this is the cost analysis and the analysis of potential savings, so that there's really good understanding of the actual revenue need. I also hear, if not consensus, a strong theme toward the resiliency of this revenue stream. I think in our conversation, for example, Sandra Hernandez brought out the point of the countercyclicality, if that's the word, of these things that when the economy is up, the needs for sort of additional public benefits for healthcare go down, but those counter-cyclical trends mean that we don't have a resilient system now. And so we need to build in a resilient system. And then lastly, I think a clear consensus that while being clear on what we're trying to achieve in terms of a single payer system, there is a political pragmatic reality here, and we need to continually weigh that in our minds. So I think those four themes are the things I'm hearing. I'd like to hear from commissioners. We have about, I would say 20 minutes before we have to turn to, no, we don't have quite that much time. We have about, let's see, let me make sure we have the clock right. We have about 22 minutes for a discussion amongst commissioners before I need to turn to public comment again. And so again, let's go ahead and use the same raising of hands to indicate if you want to, not raising of hands, I'm sorry, the same green check mark to indicate that you want to speak to these themes I've talked about or other things you heard about. And I see that Commissioner Shao, you have your green check mark checked, and so perhaps we can start with you.
I would like to share my lifetime experience working on single payer systems around the world and in Vermont. In 5 countries, I helped design single payer, adopt a single payer. The key there is to first look at how much savings you can produce from single payer and to let the public know before, so then they are, once they understand that, then they may be willing to pay higher taxes, because unified financing usually requires the government step in to take over the private financing. So that means some form of tax or some kind of mandatory contribution, including social insurance premium rates. You have to, that's the key to convince the public you're going to be the beneficiary when we make this shift. Although you look at the tax you pay, you are going to maybe pay more, but in total, you're going to save the money. That's how you actually swing the votes. Because, so that's point number 1 I would like to make. Second part is that countries basically found they have to use a combination of sources, not a single source. And the progressive tax, of course, is the principle. But you want to tie some way to say that tax you have to pay is for a set of benefits you're going to get. Then people then take ownership for that, because they say this is not charity. I paid for it, and I'm going to hold the government or whoever runs the program accountable for the performance. That's the key. So I like to share with the group these lessons we learned from decades of working on single payer systems.
Thank you, Commissioner. Are there other commissioners who want to weigh in on their experience and, again, their interpretation of what you just heard in terms of the points of commonality in the breakout groups and perhaps points of difference? Dr. Hernandez, Sandra Hernandez, can I call on you to just kind of give us your observations about how you hear this conversation today?
Well, you know, I would say, first of all, that as we thought about these principles for weighing these options, they are not all equal. And so I think what you heard today quite clearly is that given that we have a vastly inequitable system now, equity really is the prevailing principle by which we should consider any combination of these revenues, either that were discussed today or that might be discussed at a future meeting. So that would be a very first takeaway that that seemed to come from everyone's conversation here. Yeah. So I think maybe there's a conversation to be had about other components of those. We've talked about do no harm. There too, we talked principally about, paying additional federal taxes, but I think do no harm has another set of issues that might be embedded in that above and beyond the federal income tax that would be borne by hopefully workers getting higher wages as a result of a single payer system. So that would be number two. And then I think on this question of, I absolutely think I think are in consensus that we have to address the price and costs of healthcare. Really that is work that in the scope of this commission, and yet I don't think you can talk about any new revenues without having a thoughtful, detailed conversation about that issue. So those would be my very high level takeaways from the conversation that we had today. I think what the team put forward was very productive in getting this conversation moving and hopefully helping the commission think about the work to come. As we think about cost savings and we assess that, we tend to do that in numbers. We also need to think about the job displacement associated with that and where those jobs are and where they might go. Because I think to the question of the, if you will, political feasibility of this, we need to have a clear understanding that when we talk about cost savings or eliminating roles, to really understand the impact of that on the economy in California is important to keep in mind as well. That latter point is not one that I heard come out of our group, but I would think is a corollary to what we've talked about here. I hope that's helpful, Eric.
That was very helpful. Thank you. Commissioner Chin Hansen, I see your hand is up.
Yes, actually, I was delighted that Dr. Shao shared some of his experience in terms of what has been able to be successful, especially in other countries. So I would like to hear from you, given the fact that the significant work that went into Vermont, what would you say from what we've learned there, that whole level of effort and the mobilization that you were able to do with the communication notes that you shared with us, what could be learned there that would have brought it over the line to make it possible? Is there something we can learn from your reflection and your knowledge and experience there that we kind of can tuck into our toolbox to be ready?
Commissioner Shao, would you like to respond to that question?
I share what I know about Vermont, and we can also ask the former governor to come speak to the commission. But basically, why Vermont, although you passed legislation to set up a single payer system, set up an administrative agency to implement it, but you did not put together financing provision because we were waiting for the ACA to come into existence to lock in the federal payment for the ACA. During this waiting period, three things has happened. One was that in designing this system, which my team worked with all the stakeholders and the public, we estimated how many people would really support a higher payroll tax. And then we say, then that becomes a constraint how rich a benefit package we can offer. And the most progressive group of people in Vermont wants 100% coverage. But majority of the people in Vermont was not willing to pay for that. So we came up with a ratio of payment is 87%. But while waiting for the ACA come into being, the progressive group was able to pass legislation to increase the benefit package to 96%. That increased the cost of the program and the tax rate. That tilted the political balance of the supporters. That's one. The second reason was also related to our commission's work. Vermont say they will create their own system implementing ACA. The computer program they created failed, just like Obama's federal program also failed. Then people began to ask, if you cannot even create a computer program to enroll the people in the ACA, how could you run a really complex system like a single payer? So that again chipped away some of the support. Last but not least, in the last election, Vermont has a special political system. The governor has to run for re-election every 2 years. The governor run for re-election, he did not get the majority of the voting public. That election then is thrown to the state assembly. And he has to get a super majority to be elected. That actually, in that change, it gave the opponents of the single payer the power to bargain with the governor, say, if you want our vote, then you have to give up the single payer. So that part is not written up very much. But you look at the footprint, you understand what happened.
Really speaks to the political realities that were faced at that time. So do other commissioners have questions? Again, I would urge you to kind of use some time that we have remaining here, about 6 or 7 minutes, to just say, here's more information aside from the things you've already said. I would like to see in the analyses as we go forward. So Commissioner Comsty?
Yeah, I just wanted to go back to something that Janice was saying earlier in the meeting, that really we need to take the opportunity to actually get the expertise of the commissioners in this process, because Bill Shao, I've been wanting to hear what he has to say about single payer for a very long time, and I want to hear what he has to say. I want to hear what, Janice has experience at working for the Department of Insurance. I would like to hear what she has to say about insurance waste. I think we really need to reorient this discussion so that the narrative of the report, the second report that we're going to put together, is not driven by the opinions of the consulting team, and that we actually take the opinions of everyone here in the commission and put it down on paper and making sure that's recognized. And again, I hear that people want to hear about an analysis of savings, that the potential savings of a single payer system. But I also hear that the consulting team, some members of the consulting team are pushing back against that. So, I do think that there's a fundamental conflict right there that we need to resolve.
So Commissioner Ross, I see you've indicated you want to speak, and I do want to give Andy Byman on our consulting team a chance to speak as well. So let's assume we have about 5 more minutes here. And so Commissioner Ross.
Yeah, thank you, Eric. Appreciate the conversation. I thought the breakout conversation and format was great, by the way. I hope we have more of those and mix things up a little bit so we get to know one another a little bit more as commissioners. I really appreciate Commissioner Shao's experience. Would love to hear it even more. I just wanted to lift up something that came up in our breakout that was mentioned earlier in our general discussion, general session by Commissioner Myra, that we should, I think we should be more explicit on the income tax side about wealth tax. So I just wanted to sort of second that thought. That's something that we should, I think, as a commission, be explicit about and not shy away from. And I just wanted to put my 2 cents behind that thought.
Great, thank you, Commissioner Ross. So I would like to turn it over to Dr. Byman now. Andy has been listening patiently throughout this entire commission meeting to many, many pieces of feedback. And I am curious to hear his thoughts. And then we will turn it over to Karen to facilitate the last bit of public comment. And then lastly, we'll give the microphone to Dr. Chen to help us wrap up today's meeting. So Andy?
Yeah, great. Well, thanks. I've really enjoyed today's meeting, both when we're all together in one virtual room and also in the breakouts. And really want to thank the broad participation of the commissioners today. You know, I just want to kind of reference one thing. I think it was sort of said, but until we kind of got into it, it probably wasn't kind of fully, you know, understood. And that is, we had to start somewhere. And I'll tell you that as a consulting team, we even had quite a bit of debate ourselves about where to get into some of the details. And we ultimately decided we would start with financing. And as Dr. Kroenig said, we asked you to suspend belief a little bit around some of the other parts. Like here we are, we're going to talk about financing without exactly knowing the amount. And that's a hard thing to do. You know, you don't do that a lot of times in your regular life, to talk about how you're going to pay for something that you don't even know how much exactly it's going to cost. Nonetheless, we really appreciate, and I think you all gave very resounding clarity to some of the criteria of how to think about approaching financing and to think about the application of that to specific ways of raising revenue. You know, I want to emphasize that this was the entry point in, and that we showed you, I think, early on in this meeting about what's coming in the next few months. And that's going to include things that will affect that amount of money that may need to be raised. That will include things like what Bill Shao was just talking about, is what's the benefits that would be covered, or what might happen in terms of provider payment amounts. But it's also very highly influenced, as mentioned, by the amount of savings that can be derived. And again, cost containment and savings are also on the agenda in the upcoming months. So I think all the things that you're raising are 100% relevant, and in fact will be addressed in upcoming commission meetings. And I think our goal is, after we do those, to be able to then have you come back and, having seen these different components in which we've done the deeper dives, be able to come back and say, okay, now we're able to think about financing and we have a better idea about what's sort of the amount we think we need, or how might we do this in that kind of multifactorial sort of way. So, you know, we appreciate and understand why it's frustrating not to be able to do all of it at once. I mean, that's the nature of only having a few hours for these meetings together. But I actually think you did an amazing job of surfacing key issues that we can both build on and go out and get additional information that we'll bring back to you for the future discussions. So thank you very much for your engagement today.
Dr. Byman, if I could just interject for 1 second. So with the best of intentions, I'm sure Commissioner Constantine questioned whether or not the consulting team is not considering the full impact of potential savings in its analyses. And so I just want to ask you whether there is an effort by the consulting team to look at the full impact of potential cost savings, and just to have you speak to that point a little bit.
Sure. I mean, I actually didn't, I heard the comment. I didn't know what it was in reference to about why we wouldn't be looking at savings. As I say, there is a session that's coming up. I don't have the map in front of me. I think it might be in December is the one that's on cost containment. So that will obviously would be addressing savings. And so I think that is absolutely the intent of what we would get at as a part of that. So I'm not sure. I didn't want to necessarily take that on directly, but given you've raised it, happy to hear what the impression was, or why Commissioner Komsky thought that we weren't going to be addressing savings.
I don't think we need to get into that, Dr. Byman, but I just wanted to have you say something about that. And what I'm also hearing is an emphasis on the part of the commission to have a cost savings analysis done as part of this financing question. And so I'm hearing a push for the consulting team to do some of that analysis perhaps earlier on, so that the commission is more fully informed about what the range of potential cost savings are. But I don't think prolonging that discussion right now makes sense. I'm just kind of trying to communicate what I sense is the will of this commission. With that, I want to turn it over to Karen Bloomer for public comment, and then I would like to have it finally go to Dr. Chen to wrap up today's meeting. Thank you, Karen.
Thank you, Eric. So now we'll be turning to our final segment of public comment. Again, we'll be opening up the chat feature for written comment, as well as, of course, the email address is always open to you. And we will be looking for raised hands for verbal comment. But I do want to start with Cindy Young, who I understand was having trouble using the raise hand feature. So Cindy, I'm going to unmute you right now. Please go ahead and also note your affiliation. Thank you.
So my name is Cindy Young. I'm on the board of directors for the California Alliance for Retired Americans. And I have been in the healthcare industry for over 40 years. And I just want to say, every year the Kaiser Family Foundation produces an employer survey every September. And the report includes a slide that shows how much premiums, cost sharing, wages, and the CPI has increased. The 2019 report showed in the last 20 years, workers' contributions to health insurance has increased 259%. The cost of insuring a family has increased 239%. Wages have increased 68%, and the CPI 51%. Assemblyman Wood, the medical industrial complex, come back and asks for us for more money every year. It comes out of the hides of employers and workers, right? It's not like when you say, you know, we can't come back and ask for money. They do come back and ask for money. It just comes out of our pockets. So
10 seconds.
Thank you. I just want to say the OPEB liability for this state is $187 billion. Be bold, commissioners, please. You could wrap all of those costs into a single payer system and save California billions of dollars. Thank you for your consideration.
Thank you. Gerald Hunt, you're up next. Please unmute. Go ahead.
Hear me?
Yes, sir.
I'm talking about the fact that a lot of raising costs can be actually offset by the fact of inflation, because as costs go up, so does revenue. The other aspect is, like when the pandemic occurred, we could have a surcharge on top of revenue so that we could actually cover the short-term surcharge for the pandemic. And finally, we need to think about electronic communications as a basis for where we're getting more funding, because all transactions across the country are electronic. And so therefore, a small electronic cost would actually fund an awful lot of bring in an awful lot of additional revenue without really harming the transactions that are being processed. So I'll summarize with that.
Thank you so much. Bill Honigman, we invite you to speak. Go ahead.
Oh, thank you. Thanks, but once again, commissioners, you're reducing us to talking instead of taking action now when we need it. These financing considerations have been studied over and over again for California, going back to when Former Speaker Willie Brown tried to pass legislation back in 1971. Nothing is new here. Please move forward with the financing proposal given to Speaker Rendon with the SB 562 by the Perry Economic Analysis Group, and let's get on with it. Cost savings and creating better and many more jobs in the provision of healthcare is exactly what a single payer system addresses. By the way, we, the people of California, are the stakeholders here, not some corporation or foundation or endowment whose livelihood depends on a broken, corrupt, and immoral system they choose to keep in place. Our lives are on the line. Our life, liberty, and the pursuit of happiness is on the line here. Thank you, and please take action now.
Thank you. Beatriz Sosa Prada, you're up next.
Hi, again. This is Beatriz Sosa Prado with California Physicians Alliance. And I agree with Dr. Maria in the breakout room that we were in. We are to think creatively, progressively, and boldly as this world is changing by the day. What is missing from the Commission's financing discussion on revenue is the question, where do the collected funds go? CAPA proposes we establish a trust fund, which is the Golden State Care Trust Fund. And a unified system can be financed publicly by a combination of savings from streamlining and improving current systems of care and financing. It will replace private premiums and out-of-pocket payments with payments into a public trust fund that is separate from the general fund and the state budget. This trust fund would then protect healthcare dollars from being used for any other purpose. And it would also make it conceptually easier for us to understand and to implement.
5 seconds.
Because this trust fund would not be part of conflicts and the state budget. I also wanted to add that this trust fund can be financed through several ways. Some multiple revenue sources are possible, such as a wealth tax, a state tax on luxury items, and a state tax on progressive and closed loopholes. Thank you again for this opportunity.
Thank you. Margaret Copy, you're next.
Hello again.
Hello.
Okay, to the commissioners in my breakout group who would like to fall back on the public option idea or public-private schemes, you actually know that they will increase administrative complexity instead of producing the simplicity of administration required to garner sufficient savings to avoid raising so much taxes that people won't support this. So it's kind of a way to avoid actually getting a system passed. Also, the use of private companies to manage public plans has failed. Medicare Advantage must not be reproduced, neither having varying plans which promotes inequity. Thank you.
Thanks so much. Michael Leidy, you're up next.
Hi, I just want to speak on the difference between the consultant's perspective and Commissioner Shao. Commissioner Shao says we start with savings, we start with figuring out how to do it. The consultants pick up, like the Group 2 report did, on all the barriers to us achieving single payer. That's the fundamental difference. And if we take Bill Shao's approach, how do you design it? How do you make it happen? What are the benefits? What are the savings? That will achieve the objectives set out by the Commission's mandate. For example, the consultants, Dr. Koenig's trying to have it both ways on the federal exemption. It's not counted toward the public contribution to healthcare spending in California, but then all of a sudden he introduces the do no harm, let's not increase federal taxes when discussing financing.
5 seconds.
This is a question of framing and bias, and the bias has to be not on all the reasons we can't do it, but on the approach that Commissioner Shao projects. That is how we do it.
Thank you. Jeff Tartagia, you're up next.
Start my video. Okay, I guess I can do that too. I hope that works. Can you now see and hear me?
Yes, please go ahead. Thank you.
Okay, my name is Jeff Tartagia, an advocate. I spent time working in the medical profession, you might say, of medical billing. And I will say to you, the commission needs, was what I said at the start of this meeting. And I think you've done a much better job today of explaining yourself and offering to the public a better understanding of what you need to simplify of how do we get to a single payer system and bring that to the governor. You seem to not have the time for it, but we're pushing for it, and we'll keep pushing for it because this current system is not working now. And that's my comment for today. I just finished up this week with the long term on the master plan and aging. And so seeing another component.
Thank you very
There's
much.
a lot more components that you have in there you need to be considering to do this. And you need to build a trust and reserve.
Thank you
Because
very
you do
much.
not know like this pandemic. Thank you.
Thank you. Henry Abrams, you're up next.
Yeah, Dr. Abrams from Physicians for a National Health Program. I would like to ask the commissioners whether they accept the findings of the systematic review that was done by investigators at UCSF of 22 formal economic studies of the projected costs of single payer plans. It was published in January this year, and the overwhelming majority, 19 of 22 of these studies, concluded that there would be cost savings in the first year, and all 22 found that there would be potential savings over the long term. So the challenge of financing single payer can be mitigated. The challenge of financing universal, equitable, affordable care can be mitigated only by a single payer program. And furthermore, these single payer programs all had the virtue of increased utilization, but it was increased utilization
5 seconds.
of medically necessary care that was previously denied or deprived due to cost barriers. So the bottom line is there are cost savings in spite of increased access and expansion of covered services. And I would ask the commissioners whether they accept those findings. If they dispute them, why do they dispute them?
Thank you. Thank you. Craig Simmons, go ahead and unmute yourself. Sorry, Mr. Simmons. Sorry, unmute again. There you go. Go ahead.
Back with you. So I'm assuming that all of these, all the money that is assumed to be costing for the $197 billion are all to pay insurance company premiums and profits. Now, if we could establish a standard by which people that already had employer-based insurance could stay on their insurance, and those who wanted to sign up for voluntarily for a single payer system could do so, paid for by a payroll healthcare tax. That would eliminate the insurance companies and allow people to stay on their own private or employer provided insurance if they so choose.
5 seconds.
Now, the key to the cost savings is the standardization of costs, like Kaiser Foundation does, Family Foundation does, and doctors and hospitals are all in agreement that whatever service is provided, that's the exceptional. It eliminates the insurance companies and the lawyers.
Thank you, Mr. Simmons.
So
thank you very much.
thank you.
Francis Lee, we invite you to unmute.
Hi, my name is Francis Lee. I'm a private citizen at-large delegate to the Democratic National Convention. I'd like to thank Commissioner Shao for sharing his experience and just reiterate that all of his points had nothing to do with the economic feasibility of finding and collecting revenue for single payer, but instead public and political perception around it. And I'll just say that I think that anyone who shops at Costco or Sam's Club can intuitively understand that if you remove excess middlemen and you negotiate on behalf of the largest possible membership, you're gonna save money. For-profit insurance right now is reporting record profits and that money is not all being banked for our care in the future. United Health Group just last week reported that they're going to be distributing probably over $1 billion in quarterly dividends straight into the pockets of Wall Street institutional investors. It's grotesque and
5
inhumane,
seconds.
and I hope that this commission will take a bold stand to just stop dancing around unified financing and commit to single payer. Thank you.
Thank you. Jenny Chang, we invite you to speak next. Go ahead.
Can you hear me?
Yes.
Hi, I'm a state and county delegate of the Democratic Party. This is in response to one of the breakout room sessions. I'd like to protest the inclusion of nonprofit insurance companies. The influence of special interests in our government is just too strong in this country, in this state, and the potential to profit causes organizations and companies, as well-meaning as they start out, to fight against regulation every year. As an example, I'll ask you to look at charter schools that claim to be non-profit, yet they continually try to eat into the public dollars and resources. The Charter Schools Association relentlessly tries to gain leverage through the legislature, and when that fails, they assert influence over the county Democratic parties and the county supervisor seats. So you cannot assume nonprofit insurance companies will operate with the interest to maintain the public good. The public good being, healthcare to all members of society at no cost. I ask that suggestions and questions raised by William Shao, Rupa Maria, and Carmen Comsti be taken into deeper consideration. And all that said, I'm a little more encouraged by the proceedings today and dare to feel hopeful that the commission will continue listening to the people. Thank you.
Thank you very much. Robert Lehman, we invite you to unmute.
Yeah, I wanted to continue on
If you could turn up your volume a bit, Mr. Lehman, we can't hear you.
I'd like to continue on the political issue of selling whatever California comes up with to the public. And specifically, I think while the different groups have all looked at progressive ways of addressing this, that we really need to get a little bit more attention to how the financing affects businesses, and to make sure that they don't end up just having to pass through the
5
cost
seconds.
of paying for health care in California products. So one of the criteria was neutrality, and I think that's important, but it needs to be fleshed out a little bit more.
Thank you.
With respect to how it affects the end prices of California's products.
Thank you very much. So we are at 1 minute before 1, and so I'd like to turn things over to Dr. Chen. So for those of you that had your hand raised for the queue, perhaps we could keep the chat feature open so that they can make those comments in writing. And I will turn things back over to Dr. Chen.
Thank you, Karen. I'll be brief. I wanted to thank all the commissioners, the members of the public who stuck it out with us, more than 2/3 of them, as well as our consultancy team. I just want to recap a few things from this meeting. First, we will be forwarding the final environmental analysis report to the legislature and governor. I did want to respect Commissioner Comsti and Commissioner Maria's dissent. I know that Commissioner Comsti submitted significant comments that are included in the report. I would encourage Commissioner Maria to do the same on the public website. At this point, the report is finalized, but we would very much appreciate your comments. Secondly, we will continue to seek input and guidance from the commissioners as we move forward with our listening sessions and community engagement plan. Third, the videos of the breakout sessions will be posted online. Synthesis of the discussion will be incorporated into the upcoming second report. I did want to flag, we'll be talking about this more with the team, that I think there's a difference between the cost containment affordability discussion that is, I think, critical to many of the commissioners, and the cost savings piece that comes from the administrative simplification. And I think both of those absolutely will be addressed. And then lastly, just want to commit to you that we will continue to think about how do we best and effectively engage the expertise of all of our commissioners and ensure that we have a forum where we can have the give and take that I think we had more of today, in particular with Commissioner Chin Hansen, asking Commissioner Shao directly and trying to figure out how do we encourage that kind of give and take and bringing out the breadth of expertise we have. So with that, I just want to thank you all again, and look forward to seeing you next month at our next commission meeting. Have a good afternoon.
Thank you, everybody. See you next time.